after a long time.
Thank you, sir. Thank you, sir. Same here, sir.
Yeah. Varshney sir, audible?
Namaste, sir. Namaste.
Sir, namaste Guruji. Namaste, sir. Good morning, sir. Welcome. बहुत अच्छे सर. आप कैसे हैं सर?
बढ़िया, एकदम अच्छा है. सब बढ़िया, अच्छा लगा आपको.
Yes, sir. Nice to see you, sir, again. On webinar इस बहाने मुलाकात हो गई सर और रहेगा 2-3 घंटे साथ सर और मार्गदर्शन करिए सर हमको सबको.
अरे बाप रे.
हम लोगों को ज्यादा जरूरत है.
Yes.
Yes. सर, आप सब सीनियर के आशीर्वाद से हम शुरू करते हैं. ओके सर?
Yeah, Dr. Shilpa Varshney sir is guru to us, all us. Yes, sir. सर आपकी अगर इजाजत है तो शुरू करते हैं डॉक्टर.
अरे बिल्कुल सर, एकदम शुरू करिए. बिल्कुल.
Thank you.
Okay. Thank you, sir. Good morning, everyone, and warm welcome to National Web Conference of Parasurgical Procedure, The New Horizon, at SMBT Ayurved College Hospital and PG Research Institute. As per our tradition, we will start our program with worship of Lord Dhanvantari. Let's get blessings from Lord Dhanvantari. Please.
धन्वन्तरिमादिदेव सुरासुरैकवन्दितपादपद्मं लोके जराभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौका दधतमृतघटं चारुदुर्भिश्चतुर्भिः स्वच्छानिरुद्धं शुभपरिविलसनं मौलिनं भोजनेत्रं आलाम्भोजोज्ज्वलाङ्गं कटितटविलसनं चारूपीताम्बराढ्यं वन्दे धन्वन्तरिं तं जगद्भवदन् प्रौढदावाग्निनीलम् प्रौढदावाग्निनीलम् प्रौढदावाग्निनीलम्.
Okay. So, after the worship of Lord Dhanvantari, the best way of knowledge gaining is conversation, discussion, and listening the good thoughts, experiences, and interpretations by our seniors. So, for all this, we must know at least something about HOST. That means SMBT Educational Institute. So here is a small clip giving information of our SMBT Educational Trust and SMBT Ayurved College. I think you will get an idea of our campus with this.
Morning to you all. SMBT Educational Trust was established in the year of 1984 with a vision to provide higher technical, medical education and quality healthcare services to help ailing people in need through its multi-specialized charitable hospital. Our goal is to make SMBT the most respected and trusted group of the institutions in the field of healthcare education, training and healthcare delivery. SMBT Trust has been growing since day one. It has developed and worked on strategic plans and methods to educate students and provide cost-effective medical care to ailing. With that being said, SMBT has successfully branched out and established more number of schools, institutions and hospitals. Nasik is really known for its nature and healthy weather. We are surrounded by the Sahyadri mountains that provide us natural Ayurveda herbal medicinal plants. Because we are in the nature's lab, we started the Ayurvedic Institute in the year of 2007. In our institute, we offer UG courses, that is BMS, and 36 seats for PG, which are or in clinical subjects. And our experts have treated more than 1 lakh patients. The trust has established 250-bedded Ayurvedic hospital. Our Ayurveda college is guided by Principal Dr. Pradeep Bhabat sir. We also provide food and hostel facilities for students that are on par with the quality standards required. On behalf of my institute, I would like to invite you all to visit my college campus and experience the learning and service that is provided to our people. Thank you.
So now you are aware of my institute. Just like in the clip, Our institute is guided by Dr. Pradeep Bhabar sir. And now towards my department, I myself, Dr. Shilpa Bade, being HOD, professor for my department. Dr. Vinaya is associate professor, and Dr. Smita Kanade is assistant lecturer. She is on emergency duty, so she is out. She will join us. We have 6 seats in PG in our department. Now going further, I got the responsibility to introduce our chief guest of our conference, that is Dr. M.J. Kadri sir, which is actually a tough job. So we know that Kadri sir have no need of introduction. Still the protocol is there. So I will do it with honors. Sir had set many milestones in the field of Ayurveda. He is HOD professor, Shalya Tantra department in Government Ayurveda College, Nanded. He has completed his BMS and MD from Aurangabad University. He has huge teaching experience, that is 29 years for UD students and 14 years of PG students. He is also a PhD guide. Some of the important milestones in his career are: he was Dean at Government Ayurveda College, Nanded. He was CCIM Inspection Committee member. He was organizing secretary for ROTPs in Shalya Tantra, sponsored by Ayush, Government of India. He is ex-member of Academic Council of MUHS, president of Local Inquiry Committee of MUHS for various institutions. He had done massive research work, which include idiopathic thrombocytic purpura, TAO, rheumatoid arthritis, allergic diseases, anorectal diseases, and a very much work in bloodletting procedures. His hobbies include reading books, music, ghazals, shero shairi, literature, alternative medicines. Also, he is in his 37th year of teaching and in the last week of his job. On this 30th of November, he is retiring from his job only. He will be open for knowledge and teaching for students every time. I wish all the best to Dr. Kadri sir for his further life. To Kadri sir, please.
Respected President Dr. S.C. Vashne sir, Principal Dr. Pradeep sir, my friend Professor Dr. Y.G. Solanki sir, Dr. M.D. Samudri sir, Professor and HOD Dr. Shilpa Bade madam, and Assistant Professor Vinayak Bolke madam. Good morning to all. I am very happy to join this occasion. I am very thankful to SMBT Sevabhavi Trust for organizing National Web Seminar Parasurgical Procedures New Horizons. Parasurgical procedure described in the Ayurveda is the unique treatment. It is just like a minimum invasive surgery with low cost and few complications. We give the quick result to the patient. Especially cupping therapy is very useful in the treatment of cellulitis, where antibiotic, analgesic, anesthesia and dressing for long duration can be avoided. 2 or 3 sittings of cupping therapy gives the excellent result in cellulitis. Cupping therapy is also very useful in the vitiligo and having encouraging results. Leech therapy is used in Burgess disease, deep vein thrombosis and non-healing ulcers. The leech contains in its saliva herodin, which acts just like an anticoagulant. Agni karma is used in the frozen shoulder and calcaneum spur. Moles, severe backache, severe neck pain. Char also used in the Dushtavrana, infected wounds. Char Sutra is being used by many doctors, surgeons for fistula and where fistulectomy is not successful, there are so many chances of recurrences. I am very thankful to SMBT Sevabhavi Trust for organizing National Web Conference and Parasurgical Professor New Horizon. Thank you very much.
Thank you, sir. Your guidance will surely give us a knowledgeable pathway for our future life. Now, let me take the honor to introduce today's dignitaries, our President, Dr. Vaishnav sir. As you all know, Dr. Vaishnav sir is known as Sushruta of the current generation. So there is no need to introduce me. Again, it is a protocol, so I am going to introduce him. He is currently working as a Professor Emeritus in Wardha, Maharashtra. Sir has huge experience in teaching more than 40 years. He was awarded with Best Teacher Award, Dhanvantari Award, Bal Krishna Gandhi Award, Sushrut Ratna Award, Lifetime Achievement Award. Likewise, more than 10 awards have been awarded to him. He has published more than 50 articles in national and international journals. He has attended more than 100 national and international conferences. I welcome you, sir, and request you to enrich us with your valuable guidance. Dr. Vaishnav, sir, please. Vaishnav, sir?
अनम्यूट करिए.
अनम्यूट करिए, सर. हाँ. सर आपको
हाँ हेलो.
यस सर, यस सर.
हाँ आवाज आ रही?
यस सर आ रही.
ओके ओके. So Dr. Kadri sir, Principal of the college, Mr. Dr. Pradeep जी, मेरे परम मित्र डॉक्टर सोलंकी जी, समुद्री मैडम सर, और डॉक्टर शिल्पा, डॉक्टर विनय, डॉक्टर बोडले मैडम, डॉक्टर स्मिता. मैं पहले तो सभी आप लोगों को धन्यवाद दूंगा कि आपने मुझे यहाँ याद किया और बहुत बड़ा सम्मान दिया. बहुत बहुत धन्यवाद. तो आपने जो टॉपिक चुना है पैरा सर्जिकल मेजर, वास्तव में देखा जाए तो आज के युग में ये तीनों मेजर बहुत ही ज्यादा प्रमाणित सिद्ध हो चुके हैं. इट हैज बीन प्रूव्ड बाय वेरियस वर्कर्स फ्रॉम डिफरेंट कॉर्नर्स ऑफ द इंडिया. दे हैव शोन देयर एफिकेसी इन वेरियस सर्जिको मेडिकल डिजीज. If you look the history of these procedures, or you can say the status of the Shalya Tantra in India, before 50 years or 60 years, you will surprise there is hardly any person of the Ayurveda or Shalya Tantra who was practicing in the surgical field. Neither practical surgery was available there, nor parasurgical measure. They all things were the history or the subject of the theory only. Only theoretically the subjects are taught to us and we give answer in our answer book. There is hardly anybody to show the efficacy of these things. Credit goes, actually, first credit Dr. K.N. Udupa. You might have known or you might have heard about Dr. K.N. Udupa. Basically, he was AMS, Ayurveda Charya. And when he, am I audible? Hello?
Sir, audible, sir.
So when Dr. K.N. Udupa actually did his ABMS first, and then he went to abroad, and he did double FRCS. And when he returned to India, actually, so he was a civil surgeon of the Mandi. And there was a huge strike in BHU, Banaras Hindu University, that our graduate, our principal. Previously, it was the principal of the Ayurveda college was a modern person, actually. So there was a huge strike in those times, and Dr. Udupa brought up to the Banaras Hindu University as a principal of the Ayurveda college. He was a person who thought about the post-graduation and research in Ayurveda. Later on, this Ayurveda college was converted into Postgraduate Institute of Indian Medicine, and then medical college was opened in that campus. Surprisingly, the people oppose of Dr. K. Nuduppa that he is Ayurvedic graduate. How can be a principal of medical college? So he has to pass MBBS on paper actually in those times. But a lot of struggle has been done. But he did a hard work to establish Ayurvedic Shalya therapy or the surgical procedures in Ayurveda. The next person, you might have heard about Dr. P.J. Deshpande.
Yes, yes, sir.
Whatsoever we are today, actually, in every field, the person who is doing aerodactyl practice of the Char Sutra, the father of Char Sutra is Dr. P.J. Deshpande. And you will surprise, he was from the Maharashtra only. So credit goes to Maharashtra also to establish the Char Sutra therapy by Dr. P.J. Deshpande. So much struggle was done in those times to establish therapy also. And in starting period when I was there as a student, PG student, only 4 or 5 patients come per day for the Char Sutra, only 4 or 5 patients. But now you will surprise there 500 patients per day for the Char Sutra only.
Yes, sir.
And all part, and every part of the India, in every college of Ayurveda, you might have a Char Sutra clinic.
Yes.
Because of Dr. Deshpande only. And he was not a specialist of the Char Sutra, he was a general surgeon. And he operated in those days from head to toe. Neurosurgeon, thoracic surgeon, general surgeon, orthopedic surgeon, gynec surgeon. And I was fortunate to remain 10 years with Dr. Deshpande and assisted all the procedure, performed all the surgery in those days. It was a history in when your college was started in 1984. So Dr. Deshpande started the Char Sutra therapy, which is now popular in every part of the India. Then you might have heard another person from the Maharashtra itself who established the bloodletting.
Yes. Yes, sir.
Dr. Gokte from Amravati. Dr. Gokte from the Amravati. And his student, you might have Nana Joshi, near Nasik. Nana Joshi, P.T. Joshi is his student. Actually, they popularized the bloodletting therapy.
Yes, sir.
But they were doing the venesection, the Siraved only. So when I joined Vidarbha Ayurveda Mahavidyalaya Amravati, so are you comfortable?
Yes, sir. Yes, sir.
So then when I joined Amravati, actually, till that time, leech application was a subject of the only theoretical subject.
Yes, sir.
There are hardly anybody who will practicing leech application in those days. So we took a seminar on leech application only. This is a postgraduate seminar. Postgraduate seminar, you will surprise. So one of my student, Dr. Manju, she is our associate professor in Amravati itself. So I gave her a topic of the leech application. So there was a good seminar, good discussion. So we thought that why not this problem should be given to a postgraduate student. So I gave this problem. The first student is of Manju. Now she is Kalmik, the Chokhande previous.
Yes, sir.
So I gave this Manju. So I gave this problem to her to do her MD study actually. So now the question, from where we get the leech? Hardly leech available, not out there. So anyway, we tried, we approached to geology department of Amravati, the geology department, the postgraduate department of geology. There was a madam, her husband was my patient for the fistula. So I asked him, when can we get the leech? So she told, it is in our curriculum. So our technician will supply you leech. So first we got leech from a technician of the geology department of Amravati. So we started this therapy. So first we start this therapy on the horizontal basis. Means every patient, the indication, according to indication, the inflammatory condition, thrombotic condition, the glandular swellings, the allergic condition, and we apply the leech. You will surprise, we got a very wonderful result in all these cases. So this was now the first study in our Amravati. So I just presented in various seminars, various places. So first of few persons they are in oppose the how this worm or kide they will be effective. There is a senior persons who are not in favor of the leech application, but because of the hard work of my student, and wherever I present this work, the person start there itself. Now I am very happy that every part of the India, the leech application is now a established therapy for various surgical-medical conditions. So it was very good. So in start condition, I will share some experience. There was a madam, gynecologist, famous gynecologist in Amravati. She developed actually this obstruction of the vascular obstruction of the leg, and there was a gangrene of the fourth or fifth toe, actually black color. So in those days, the color Doppler was done and found that there is an obstruction. But so much pain was there, she couldn't sleep in those days. So she tried various, Ayurveda can do it. So she called me, I went there and see. Okay, madam, we will try. So we apply leech in this patient, in her. So next day she told, no, I'm not getting relief. So I told her, we will stop the treatment. Well, no, please don't stop it. I could sleep for an hour, only 1 hour. You continue this treatment. So we continue the treatment, and you will surprise that after 15 days, the color Doppler was normal, and his finger, the color of the finger become normal, pain abolished, swelling abolished. So this is how we got encouragement from. So this was a vertical study. We did the study in every case, whatever the mention in the text. Next stage come when we try to find out whether there is any side effect of the leech application. Okay. So, there are few students of mine, they have done the liver function test, kidney function test, and other parameters to find out whether there is any toxicity of the leech application. So we couldn't find any toxic effect of the leech application. So we continue. However, we find some undesired effect. Like in a few cases, there is a huge bleeding, which are not able to control by simple measures. So we apply the pressure bandage for long time, and this anticoagulant was there. We apply, no doubt, we could be able to success in the manage the complication. So of the leech application, few complications are there in this in early days. So we take precaution. We did PT, BT, CT before application. We did other measures to do before we do the leech application. This is how we could establish the therapy of the leech application. We couldn't find any side effect. Then the third stage start. First stage was the experimental, rather you can say. Second, to find out whether there is any toxicity or not. The third, what is the scientific answer for leech application? How it is effective? So one of my students, the Sheetal Asutkar from the Nagpur professor, I gave this problem for her and to measure the CRP, C-reactive protein. You surprise, after leech application, the value of the CRP is reduced. So this is how we can simply say that it is an anti-inflammatory. This is a proved anti-inflammatory agent in the saliva of the leech. The scientific study was done. Angiogenesis was observed in the wounds. So it is very helpful in the healing of the wounds also, in the inflammatory conditions also. So this is how the study goes on. And now we are getting the scientific answers for that. And every part of the India, they are using leeches in their practice. So this is one aspect of the parasurgical measure, is a leech application, how we start and how we are doing this work. Now next thing is a Char Sutra. Now you know the Char Sutra is a very now popular method to treat not only the fistula, it also treats many conditions, many surgical conditions. One of my students, the Karnavat from the Aurangabad, she has done the first study in Amravati, Chedya, Bhedya and Lekhya property of the Char Sutra. And we found that all the conditions where Chedan was indicated in minor conditions, the Char Sutra is equally effective. We ligate the Char Sutra in pedunculated growths like papilloma, like this syndactyly, like other small skin swellings. You ligate just the Charsut, we got the result. This is a Chet effect. Simply it is a Bhed effect. In Pitradi, when we can puncture and we can probe the word Charvarti, you will get a very good result of this Bhedan Chikitsa. Then Lekhan also, the chronic wounds where the debridement is indicated, you apply the Charsut, put the Charsut there, and you will get a very good result at the Lekhan effect. Sadhya, Bhed and the Lekh property of the Charsut we have established. And now another thing, the traditionally the Charsutra which has been described or which is mentioned, the Isnui Charsutra, it has Isnui latex of the Isnui, Euphoria nerifolia, Euphorbia, and the Acanthus aspera, this char, and the turmeric. So what I found in my practice, it is more irritant. Patient feel pain by this Charsutra. So initially in Banaras itself, we found that if you use another Char Sutra that is known as simply by the Udambar Char Sutra, we call it Udambar Char Sutra. The latex of this Udambar plant, you might have heard the Udambar. So we paint 11 coating of this Udambar and we found a very good result. And now after that we are using this Udambar Chir Sutra, rather you can call it a Char Sutra, but it is Chir Sutra. You coat 11 coating of the Udambar and you got the same result. And at the other side, the patient feel minimum discomfort, minimum pain if you use the Udambar Char Sutra. So it is very good to use in practice, not only in the fistula, as I told you, in every disease where the Chedan, Bhedan and Lekhan is indicated, you can use this Char Sutra. It's very effective. There was a famous physician in Amravati, now he is no more. He developed the fistula actually. He was a modern person and somebody told him to go for the Charsut treatment. He came to me in early days when I started my career in Amravati. So he took 1.5 hours to discuss about simply about what is Char Sutra, how it is effective, what if there is any toxicity, anything. So many questions. So I politely answered everything. So he came to me for the treatment and he was recovered from his fistula. Then he told amongst his person, amongst his friends. So every surgeon from Amravati referred the cases of fistula to our Ayurveda only because of that person. So this is how the Char Sutra therapy got popular in those. No doubt, few undesired effects also observed in the Char Sutra therapy. So you must be able to treat all these undesired effects. So before you are going to these parasurgical measures, as the Sas told you, this Shishunam Sastra Bhiuranam Nadi Marmasate Char Sutram Tam Chindatya Natu Shastrena Buddhiman. Shastra say it is operative procedure. In those days might have recurrences, might have problems, anesthesia, might have some other things. So they have used this parasurgical measure, the Charsut, to treat this condition, this is fistula and others. The same method has been made in that shloka next, Arsha, Arbut, etc. So they have clearly indicated that Charsut can be efficacious or effective to manage all these conditions. So this is how the Char Sutra is a very ideal therapy to treat these various conditions, especially the fistula and the pilonidal sinus. It's a very good indication for this Char Sutra therapy. So this is another thing. The Agni Karma is again in another parasurgical measure which was started earlier also. There are so many persons was doing this Agni Karma in various capacities in either private practice or in the college. It was a therapy which was seen by in those days also. So, but there was hardly any scientific study. So we went in Banaras University. We start the Agni Karma in scientific way. Now Dr. D.N. Pandey, head of the Sangyaharan department, now doing very scientific study on this Agni Karma. He has measured the temperature in different shalaka, the time, and other things to present in a scientific way. That is the Agni Karma therapy. This very good. So these all the parasurgical measures are the very, rather you can say, very effective measure to treat various surgical medical conditions. Now again, the credit goes to the ministry or the effort of our Prime Minister. They have recognized us as a surgeon also. They have given a status to do all sort of surgery. And there are so many persons in Ayurveda, my friends, my students, they are doing good surgeries, very good surgery. Now they are getting good general surgeon, they are laparoscopic surgeon, they are doing all sort of surgery. But as you say, there is some hitchak rather you can say there was there's somebody recognize, somebody don't recognize them. Whether a lot of time the question is been asked by various Ayurvedic persons also, whether you can do surgery or not surgery. In visiting committee, if a pure Ayurvedic person come to you, if you show him about your surgical work, he surprise you how you are doing this work. Our Ayurvedic person were opposing those days also. Nowadays also, there are few person. It is not opposed from the medical field also. In Ayurvedic field, it is opposition from the Shalya department. So Shalya has become a Shalya to rather you can say for other persons also. So it is time to remove that Shalya by either surgical measure or a parasurgical measure or such type of seminar or webinars which you are arranging. This is the method how you can bring out that Shalya from the body, from those persons who are opposing the Shalya Tantra as a established department. I am not going detail in the therapy because Dr. Solanki, my friend, is going to show you the results of the disease. I have lot of study, lot of cases with me actually to show you the therapy. But because of Dr. Solanki is there, he is a good friend of mine. He will show all the evidence basis results. So in short, I can say thank you very much for providing me the time to speak something about the parasurgical measures. Thank you, madam. Thank you.
Thank you. Thank you, sir. Thank you very much, Vashne sir. Our principal sir has also joined with video conference. Yes, sir. Thank you very much, Vashne sir. Your presence in the webinar is really an honor for us. You have messaged us to dedicate our subject, dedicate our work, and it is very helpful for us. Thank you, sir. And for further session, I would like to invite Dr. Solanki sir. It's my immense pleasure to introduce Dr. Solanki sir. He is Dr. Solanki sir is presently working as professor, also PG teacher and PhD guide at Shalya Tantra Department, R.A. Poddar Government Ayurvedic Medical Hospital. Sir also works as principal investigator in various clinical trials of Ayurvedic formulations. Sir is director of Shasutra certificate course being conducted at R.A. Poddar Ayurvedic Medical College. Sir has been resource person and guest speaker at various ROTPs, national and international conferences. His research work and paper has won first prize at national conference held at Kolkata, held by CCRAS. Sir has awarded with the Nana Joshi Memorial Gold Medal Award. We heartily welcome you, sir. I request Dr. Solanki sir to share his knowledge with us. Namaste, sir. Good morning. Good morning, sir. Good morning, sir.
Good morning. Namaste. Thank you, Dr. Vinaya, for a good introduction. And let at the outset only thank me to SMBT Ayurved College Hospital and PG Research Institute, Igatpuri, for inviting me for joining as a guest speaker in this wonderful program. Respected Dr. Pradeep Bhabar, principal of this institute, a very honored and respected Guruvarya, Dr. Subhash Chandra Varshney sir. It's a great honor that he will be attending my presentation and adding his expert comment later on, positive and negative, both, sir. I'm expecting it from you. It's an honor that I am in the same conference where Varshney sir's presence, august presence is there. Dr. Shilpa Bade, HOD and professor of Shalya Tantra department. Dr. Vinaya Bodke, who has been behind me since last 2 months for this webinar. Initially, I had told her no. I told Vinaya, I am in webinar fatigue, the way people are in this COVID fatigue. I am in webinar fatigue. So many webinars to attend or speak to or panelists, etc. So initially I told Vinaya, नहीं Vinaya, मैं नहीं बात करूँगा, मैं थक गया हूँ. She said, नहीं नहीं sir, आपको आना है. She is our student from my institute. I could not say no to her further pestering, and I resented and I agreed, and then we worked out on this thing. Dr. Vinay, Smita, another assistant professor of the institute. It's a great honor to be in this program with me. Dr. Vinay, give me a minute for sharing the screen and my presentation.
Yes, sir. Yes, sir. Yes. Yes, sir. Your screen is visible, sir.
हमारा video. Yeah, I'm audible and visible both.
Yes, sir. Audible and visible both.
Yeah. Sorry for that 1 minute gap because I was trying to get the screen, which you got it. And it was a great thing when Dr. Varshney sir was speaking, and he took us back to 50, 60 years of scenario in the country, and a institute like BHU, and then the scenario in Maharashtra. And during his speech, he referred to Vaidyanana Joshi's name. And सर देखिए कैसी दुनिया छोटी है कि द लीजेंडरी डॉक्टर वैद्यनाना जोशी, इनके नाम का बॉम्बे यूनिवर्सिटी का अवार्ड मुझे मिला है. इट्स अ गोल्ड मेडल इन द नेम ऑफ वैद्यनाना जोशी. आई एम ए रिसिपिएंट ऑफ दैट गोल्ड मेडल वैद्यनाना जोशी अवार्ड फ्रॉम मुंबई यूनिवर्सिटी व्हेन आई ग्रेजुएटेड in 1985. So it was a great honor कि आपके मुंह से वैद्यनाना जोशी सर का भी नाम सुना, और लीजेंडरी आयुर्वेदा प्रैक्टिशनर डॉक्टर गोगटे, जिन्होंने एक जनरेशन तैयार की थी. Anyway, coming back to today's my presentation of parasurgical procedures, New Horizon. So at the outset only, let me clear that what Varshney sir mentioned, the famous popularly practiced Ayurvedic parasurgical procedures, Kshar Sutra, Raktamokshan, Agni Karma. I am going to talk about the parasurgical procedures other than these. इनके ऊपर मैं बात नहीं करने वाला हूं आज. इस सब्जेक्ट पर बात करने के लिए, क्षार कर्म एंड क्षार सूत्र पर बात करने के लिए, डॉक्टर समुद्री इज ऑलरेडी इनवाइटेड. इज इट डॉक्टर विनय?
Yes, sir.
Yeah. And Dr. Shubhangi Badole, another student of mine from Podar Medical College, she is going to talk about the analgesia and Agni Karma. She is going to talk. So I'm not going to talk on these procedures. I'm going to talk on other procedures which the way Varshney sir described, that how the parasurgical, these famous parasurgical procedures made famous and came into routine with a great success story. So we are working out now other parasurgical procedures that I will be talking to. And in the outset only, let me tell you that legendary Dr. Deshpande, under whom Dr. Varshney sir is trained, and Dr. Varshney sir himself is a legend, and he has trained the generations of the Ayurveda surgeons right now practicing across the country, not only in Maharashtra. So with the success of Kshar Sutra, Ayurveda surgeon captured the whole proctology. They rode the wave of success of Kshar Sutra. And अभी maybe मैं जरा थोड़ा ज्यादा बोल रहा हूँ वार्ष्णेय सर कि क्षार सूत्र इतना हाइप हो गया कि कि it entirely covered the whole proctology use, और मेरे कुछ आयुर्वेदिक मित्र सीनियर और जूनियर हर किसी चीज में क्षार सूत्र का उपयोग करने लग गए। हालांकि क्षार सूत्र का उपयोग भगंदर में भी काफी मर्यादित स्वरूप में सुश्रुत ने कहा है, सुश्रुत ने छेदन भी कहा है, सर्जरी भी कही है भगंदर में, लेकिन क्षार सूत्र ने इतना व्याप्त कर दिया कि दूसरे पैरासर्जिकल प्रोसीजर लोगों को दिखाई नहीं दे रहे थे, वो क्षार सूत्र ने व्याप्त कर दिया। सेम सक्सेस स्टोरी व्हाट डॉक्टर गोगटे, डॉक्टर वार्ष्णे सर started practicing about Raktamokshan and Jaloka. The success story went on to entirely encircle the other parasurgical procedures के इतना उसको हाइप हो गया है अभी यूज ऑफ रक्तमोक्षण एंड पर्टिकुलरली लीच एप्लीकेशन उसकी सक्सेस स्टोरी से कि दूसरे पैरासर्जिकल प्रोसीजर की तरफ अभी हमारे नए बडिंग पोस्ट ग्रेजुएट और रिसर्च वर्कर्स ज्यादा देख भी नहीं रहे हैं। एज अगेन डॉक्टर वार्ष्णे सर सेड कि अभी पेन मैनेजमेंट के ऊपर बहुत एक्सटेंसिव वर्क हो रहा है एंड रिस्पेक्टेड प्रोफेसर डॉक्टर पांडे फ्रॉम BHU ही इज साइंटिफिकली वर्किंग ऑन दैट पेन मैनेजमेंट वर्क थ्रू अग्निकर्म। ये सुनकर बहुत अच्छा लगा। एक अभी धन्वंतरी जयंती पर और उसके पहले डॉक्टर PJ देशपांडे मेमोरियल ओरेशन में भी इनके प्रेजेंटेशन BHU में हुए थे और मैंने उनका प्रेजेंटेशन सुना। सो लेट अस एम्बार्क ऑन माय प्रेजेंटेशन about so as earlier said by our learned guru, what are the parasurgical procedures? These are the procedures they do actually the surgical work without doing the surgery. That's why these are known as a parasurgical procedure. And in some procedures, with the success of these procedures, surgery can totally be avoided. They do the work of the surgery, and in some places it works as an aid helping procedure to the main surgical procedures. And as sir mentioned earlier, these are the which are popular and very much practiced with great success are Kshar Karma, Agni Karma, Raktamokshan, Viddha Karma, etc. These are the karmas. But in my presentation, I am not going to talk much on this. Only there is one patient of Kshar Tel application, not actually Kshar. It comes as Kshar Karma only, but Kshar Tel application I'll be showing on actually patient. But about other procedures, I'll be showing you 1 or 2 patients before and after treatment evidence during this, and how these parasurgical procedures can be popularized, can be worked on scientifically, and can be brought forward to the medical fraternity, not only in our country, but in front of the world at large. So why the need is felt for touching upon the other select few procedures? Because as I said earlier, that select few parasurgical procedures are so much popular that it has made the cloud cover on other procedures. Kshar Sutra, Raktamokshan, Agni Karma, the success story, the popularity, the economical ease has made it so popular that other procedures, so we need to highlight it, we need to work on this, and we need to bring it forward by doing a clinical work. As Varshney sir said, that surgeons from Ayurveda are busy doing surgery and they are earning their dal roti and bread and butter and everything through surgery, and they get carried away into that surgery, and after a few years they lose the interest in Ayurveda and they are not looking at the other procedures described in Ayurveda. So what's happening is there are few private practitioners who are concentrating on this. Mainly such procedures are looked and practiced in the Ayurveda Institute or a research institute only. Academia, majority of the academics, especially youngsters, they are after their survival. They want to survive, so they are working in that way. But in my further presentation, I will show you how we can utilize these young academics and their energetic work, and we can divert their attention towards these popular procedures. So why we need? Because the young generation is feeling clueless. My students who are joining academic institutes or practice, they often come to me and talk to me कि सर क्या करें, कुछ दिशा दीजिए, कुछ बताइए हमें. And then I have to talk to them that there are a lot of potential areas on which we can work through proper parasurgical procedures. These are the areas where parasurgical procedures help, and those who are practicing surgery, be it a modern surgeon or Ayurveda surgeon, they will understand that Sometimes there are no answer to non-healing wounds, chronic inflammations. Pain management has become a big obstacle in the operative and post-operative, and there is a big field waiting for research workers. That is cosmetics is the new emerging field. But these are the field and these are the potential areas where we can work. And dear friends, Sushruta has gifted this world a very big parasurgical guideline area, that is 60 therapeutic guidelines he has described in Sushrut Chikitsa Sthan for the treatment of the wound, and these are known as a Shashti Upakram. These 60 therapeutic guidelines are all parasurgical procedures. If we work on one or two procedures, believe me, a one devoted doctor's lifetime will not be enough to have a very scientific good work to evaluate the efficacy of that. And that success story Sushruta has put forward, and that is a बड़ा खजाना देकर गए हैं सुश्रुत हमको, हमारे सर्जिकल वालों को. ये सिर्फ षष्ठी उपक्रम की बात अगर करेंगे तो I'll be showing you other procedures also which are beyond the preview of this षष्ठी upakram also. Then in pain management, Vidya Chikitsa, Dr. Shubhangi Badole might touch upon Agni Karma, but there are Vidhagni Karma and Vidya Chikitsa. There are people who are practicing like Dr. Uday Kulkarni in Thane, Dr. Mahesh Sanghvi, who is a Shasutra expert, but he is working on the Vidhagni Karma. Dr. Shubhangi Badole, who will be the next speaker tomorrow, she is also working on this field. So they are doing a great work, and soon they will come out with a very good scientific presentation and success story on these works, I believe. Another new area which has emerged from the Ayurveda and Sushruta Samhita is Marma Chikitsa. I'll be talking about Marma Chikitsa in detail later on in my later slides. And as I said earlier, cosmetics is again another area where we can work well during our parasurgical procedure study. So why we need to work on other parasurgical procedures, as I said, because there are procedures, as Varshney sir said, कि हमारे आयुर्वेद वालों को खुद को पता नहीं है कि ये पैरासर्जिकल प्रोसीजर हो सकते हैं. लाइक षष्ठी उपक्रम का पहला उपक्रम सुश्रुत ने बताया है अपतर्पण. The very first procedure in 60 therapeutic guidelines for the treatment of is apatarpan. I'll be talking about apatarpan, and I'll be showing one or two patients where the apatarpan, how it has worked, I'll be showing you. Lekhan karma is what we know in modern surgery is debridement. Wound debridement can be done surgically, or wound debridement can be done chemically. Chemical wound debridement is done with medicine, and Kshar Sutra is such wonder drug, Ayurveda herbal drug, which does the Lekhan karma. The Kshar itself does the Lekhan karma. I'll be showing you one patient where the Kshar has worked well for chemical debridement, that is Lekhan karma. Same way, Sandhan karma, Vidya karma, and this Varmology is known in the South India, this Marma Chikitsa, they call it as a Varma, and Varma Chikitsa or Varmology. There are experts working on Varma Chikitsa or Marma Chikitsa in South India. Sports medicine, which has come up as a branch of orthopedics in modern medicine, but there are some Ayurvedic doctors. One of my students from Podar, Dr. Sandesh Chauhan, is working on the spine and joint treatment. He is an Ayurveda postgraduate. He is doing wonder treatment. He is a visiting physician in Pune also, and he has got a very good practice established in Mumbai, Kurla area. And he is working on the spine injury, joint injury, tendons, and he is doing manipulation along with Snehan, Svedan, and exercises. That is the area we need to work. These youngsters should concentrate, and we need to again practice with a success story and propagating the established parasurgical procedure, which are Kshar Karma, Agni Karma, and Rakta Mokshan, not to forget them. So, as I said earlier, the very first procedure of Shashti Upakram, that is 60 therapeutic guidelines in the treatment of the wound management protocols, Shashti Upakram, the first Upakram is Apatarpan. Apatarpan is a Sanskrit word derived from the word tarpan. Tarpan means nourishing the body with nourishing substances and especially the fluid. And apatarpan is depriving the body of nutritional fluid and liquid. That is apatarpan. It's a type of fasting. Every religion advocates fasting. Every religion advises fasting, periodic, regular fasting. There are some religions who advocate very extensive fasting. Jain Dharma gives a very extensive fasting. Muslims, they fast month long in the month of Ramzan. Hindu religion does advise fasting of various ways. Ayurveda, through Sushruta Samhita, advises fasting or apatarpan in the management of wound and inflammation and pain. For these various purposes, Ayurveda advises fasting. Dear friends, Yoshinori Osumi, the Japanese biologist scientist, won the Nobel Prize of Medicine 3 years back, only working scientifically on fasting. And he established that consecutive fasting, how it digests and destroys the precancerous cell, and how a fasting helps in the prevention and management of the cancer. Friends, fasting induces the renewal or recycling of the cell contents, and the cells, they go into the mode of autophagy. The phagocytosis is a process where the cells destroy the toxins, where the cells destroy the antigens which enter into our body, and this is known as autophagy. Autophagy is augmented, autophagy is activated, autophagy is enhanced, autophagy is stimulated when we fast. Fasting reduces inflammation, and dear friends, fasting is associated with longevity. आयुष्मान बढ़ता है खाने से नहीं, कम खाने से या न खाने से. That is established now through scientific work, but our Sushruta Samhita advocated this fasting in Shashti Upakram. Let us see how this apatarpan helped me treating the patient. Dear friend, this is a photograph of a patient who was developing an abscess over the back. This arrow is showing day 1 photograph that we encircled on the inflammation on day 1. This outer circle describes or shows where the inflammation was on day 1. And day 2, this inflammation was limited here. You can see small tiny pores arising. This is showing that inflammation is subsiding. This was on day 2 and the photograph was taken on day 3. Day 3, the inflammation is limited up to here. No drug, Ayurveda or allopathy, anti-inflammatory drug was given. No antibiotic was given. Only apatarpan was advised to this patient, and within 3 days, the amount of analgesia, the amount of inflammation, it reduced. You can see with a scientific work. I'll show you another perianal abscess patient. This is the anus, and this is the abscess patient was developing. Again, the outer circle is showing the area where the inflammation was there on day 1. And on day 2, the inflammation circle has gone down half an inch lower. And you can see the wrinkles arising. Wrinkles shown are sign of subsiding abscess. Patient less complain of pain. The fever went down, which is a generalized sarvadehik lakshan. It subsided, and only apatarpan. Dear friends, apatarpan gives wonder result in breast abscess. Lactating mothers who suffer commonly from breast inflammation, and sometimes this inflammation is converted into a breast abscess, which is, I think, 5 to 10% of percentage lactating mothers they suffer from. Give them apatarpan and you will find the wonder results that abscess is subsiding. That was the one procedure I wanted to show you. Another parasurgical procedure which is described in Shashti Upakram, 60 therapeutic guidelines described by Sushruta Samhita in treatment or in the management of wound, that is Vrana Chikitsa. One more is Avachurnan. Avachurnan is a process whereby we do the dusting of herbal powder over the wound area, where we use a very fine, mahin churna, fine powder, herbal powder over the infected wound area. It's very economical and ancient, because it is described into ancient Ayurveda Samhita with no side effects. Rather, I'll show you how it gives side benefits rather than give side effects. And I carried out, as Varshney sir said, that we need to have a modern parameter study to establish our claim in front of the world. And in my next slide, how I'll show you that we have to train youngsters to talk in a language the world understands. The world understands our study, and that's why we need to do some modern studies also. But remember, these all parasurgical procedures are highly skilled work. It says, I will say, not so specialization, it is a super specialization, because at one hand you need to have a allopathy knowledge, but at the same time you have to have a detailed in-depth knowledge of Ayurveda, because churna, you need to know how it is prepared, what is the shelf life of churna, how it is not allowed not to get contaminated, how it is preserved, and you need to know when the churna has got expired or its efficacy. That is saviryata, what our ancient samhita described, saviryata. So shelf life you should know. So you must have a very good knowledge of preparation. ये किसी ऐरे गैरे का काम नहीं है, या ऑर्डिनरी बीएमएस ग्रेजुएट का भी काम नहीं है कि पैरासर्जिकल प्रोसीजर. यू नीड टू, इसके लिए बहुत अच्छी साधना करनी पड़ेगी, अभ्यास करना पड़ेगा, knowledge लेना पड़ेगा, and then you will have to implement it, and definitely you will get the success out of this. This is a patient's photograph. We did work, as Varshney sir was telling, कि उन्होंने अपने स्टूडेंट्स को पोस्ट ग्रेजुएशन के लिए और बाद में रिसर्च वर्क, पीएचडी डॉक्टरल थीसिस के लिए अपने स्टूडेंट को टॉपिक दिया था. Same way, I had given these parasurgical procedure. I wanted to have a good scientific work done, and that's why I had given such kind of topics for paper presentation or for thesis writing on this. You can see this patient has got an infected wound, and no doubt we had to do the surgical debridement of this wound. The problem is, when you do the surgical debridement, there are some micro elements which remain with the wound, and 3 or 4 days again the debris material, the slough, the pus appears on the wound, because that micro material which is not visible to our eyes, we are not able to take it out surgically. Modern medicine advises so many topical ointment like pyridine, iodine, etc., etc., washing with hydrogen peroxide, etc., etc. Despite of that, after 3-4 days, the slough appears, the infective material appears, and you need to again do the surgical debridement. So, and you have to administer the systemic antibiotic for treating such wounds. So what we did is, after surgical debridement, we did Auchurnan. Now for Auchurnan, Sushrut Samhita describes hundreds of herbal preparations. Lot of very popular are Neem Churna, Arka Churna. Kshar itself can be done with Auchurnan, or Kshar Karma or Pratisarni Kshar can be used. We have done scientific work on infected wound and Pratisarni Kshar also, but I'm not going to showcase Kshar Karma because Dr. Samudri is scheduled to talk on this. So I preferred a very less known herb, Gorakhmundi. It is Sphaeranthus indicus, an Ayurvedic indigenous herb, and we prepared a Mahin Churna, and we did daily once, दिन में सिर्फ एक बार ये गोरखमुंडी का चूर्ण अवचूर्णन वुंड पर इस तरह से कर लिया करते थे. And you can see daily once only अवचूर्णन surgical debridement करने के बाद how little slough is there. Rest whole wound is healthy. Only this much slough can be seen on the day 5th, and day 7th the whole wound started healing, and what शुद्ध व्रण जो सुश्रुत संहिता ने डिस्क्राइब किया हुआ है वैसा ये शुद्ध व्रण हो गया. So within day 7, from day 1 surgical debridement and 6 days of Auchurnan has given such healthy wound in this. Another patient for again infected wound with Gorakhmundi Auchurnan I wanted to show you is same way. Even in such patient where on the lower extremity and lower 1/3, these wounds are very difficult to heal because of the poor blood supply in this area, and you can see the some varicosity discoloration on the legs, and this patient kept on getting slough despite of surgical removal, despite of antibiotic administration. We did Gorakhmundi Avchurnan and see the very healthy granulating wound. So Vrana Shuddhikaran was the only aim done with Gorakhmundi Avchurnan. व्रण रोपण ये दूसरा कार्य है. व्रण रोपण के लिए और आयुर्वेदिक औषधियां उपयोग में लाने पड़ेगी. यहाँ पर हमने अवचूर्णन से सिर्फ व्रण शुद्धिकरण अचीव किया है. एंड यू कैन सी another procedure of about Avchurnan only. Let me tell you, we did a scientific work on this Gorakhmundi Avchurnan. What I did an antimicrobial study of Gorakhmundi Churna. I wanted to see on which organism this Churna is effective. And if my friends, those who are on the really laptop or desktop, they can see on big screen. Telephone, जो mobile phone पर अगर कोई ये slide show देख रहे होंगे तो they will not be able to appreciate. But you can see that E. coli, very dreaded organism causing infection, Gorakhmundi Churna was very effective. That is 18 to 17 and mean 17.7 mm of zone was sensitive, means organisms were killed. This another organism, Staphylococcus aureus, 13 mm of zone was effective, and Streptococcus pyogenes, 11 mm of zone. The less impressed zone was Propionibacterium acne, was only 10 mm of zone was effective. But ये भी कुछ कम नहीं है कि herbal powder local application has killed that much organism, especially E. coli. The 17.7, almost 18 mm of zone was, this was done in a authentic microbiology lab of Khalsa College in Mumbai, and thrice it was repeated to affirm my claim that Gorakhmundi Avchurnan helped removing the slough without systemic antibiotic or without any antibiotic application. Rather, Gorakhmundi worked as a local antibiotic, and this study established. We have published our paper on this topic. As I said that I am not going to talk on the Kshar Karma, but only one patient of Kshar Tel Puran I am going to show you that how Kshar Tel Puran helped me get healing. Friend, this is a patient, 38-year-old male patient having recurrent fistula in anu. Fistula is a disease having a very good recurrence rate, and because of Kshar Sutra, we have reduced this recurrent rate. Those Ayurveda doctors who claim कि Kshar Sutra से recurrence rate 0 हो जाता है, मैं उनके साथ सहमत नहीं हूँ. I disagree with these people. Even Kshar Sutra has got a recurrence rate. It's very less. It's minimum. और वो Kshar Sutra करने वाले की और क्षार के जो औषधि द्रव्य हैं इनकी कमतरता या गलतियों की वजह से रिकरेंस रेट ज्यादा है. That periodic change is missed, the procedure is not properly followed, etc., etc. Because of that, the fistula recurs even in Kshar Sutra. So, and surgery में तो Kshar Sutra का recurrence rate around 10 to 15% है. If you do the fistulectomy or fistulotomy, etc. Again, this is same patient of Kshar Sutra recurrence. MRI, all recurrent fistula patient, we do the MRI, and we got an answer in MRI that this was an intersphincteric fistula having a large abscess cavity. So what, because of sphincter involvement, the surgeon is afraid of encountering the sphincter or incising the sphincter, and this is the internal opening. Okay, but this cavity was not taken care of in previous surgery, which was revealed in MRI, and because of that there was a recurrence. So even as an Ayurvedic surgeon, I was afraid because it is intersphincteric plane, and in intersphincteric plane there is a large cavity. So how to tackle with this? So what we planned is, we did the surgery up to this level, only up to this level. Partially external sphincter erode करके, partial थोड़ा cut करके, we put a Kshar Sutra. You can see this film. This is a Kshar Sutra. This is a demonstration I'll be showing you actually on patient. This is the Kshar Sutra we put, and then we did the Lekhan Karma, that is scooping in this abscess cavity. We reached there, and then I put the Foley's catheter. Friends, Foley's catheter, which can be kept into the bladder for a long time because of this balloon created into Foley's catheter. So we pushed the Foley's catheter up to the cavity. We inflated this balloon with liquid so that this Foley's catheter remains in this cavity. What was the aim of putting Foley's catheter? Because I wanted to put the Kshar tail through this and wash the cavity daily. That was the plan of treatment. And you can see this is the intraoperative picture. As I said, this is muscle, sphincter muscle, you can see. This is the probe with Kshar Sutra we put through internal opening, and this is the external sphincter partly debrided with the abscess cavity, and this is the cavity intersphincteric plane. We pushed Foley's catheter into that intersphincteric plane as I showed you in this demonstration. See, this is Foley's catheter. I pushed it into the internal cavity and inflated the balloon and pulled the catheter so that this balloon remains here into this intersphincteric cavity. The Kshar Sutra is in situ, as you can see in this picture. And why this Foley's catheter? Because I wanted to irrigate daily this cavity with Kshar tail. That's why I put the Foley's catheter. And this is the video, dear friends. You can appreciate the video. I am doing daily with Kshar tail irrigation. See the Kshar tail trickling out from the cavity through Foley's catheter. I am pushing it. I'll replay again for your appreciation how I irrigated with Kshar tail. So as you know, plain तिल itself, आप लोगों को पता होगा, दादी माँ कहती है कि अचार लोणचं अगर खराब नहीं होने देना है तो उसको पूरे अचार को डूब जाए इतना तेल भर देना चाहिए. So oil itself works against preventing the infection occurring into this, and this is not ordinary oil. This is prepared through strong herbal alkali, Kshar tail. This Kshar tail is autoclaved, and this Kshar tail with a perfect antiseptic precaution, wearing gloves, washing this area, and because Foley's catheter is kept in situ, this Kshar tail is pushed daily into that cavity every day. And what I did is, after 4 or 5 days, I reduced this liquid into the balloon. ये balloon को छोटा कर दिया, so that the cavity allowed to collapse and heal. Every 2-3 days, balloon छोटा छोटा करके पीछे पीछे खींच लिया गया, so that cavity is allowed to heal. अगर balloon इतना के इतना ही रखेंगे तो cavity को दबाए रखेगा. It will not allow granulation tissue to grow. We wanted granulated tissue to grow and also to take care of the slough or any infective material which was washed away with the Kshar tail every day. So this is intraoperative play. This is the video I played. And friend, the final stages of healing after 3 weeks in this fistula patient. You can see it has healed up. I have removed the Foley's catheter because I got evidence of cavity collapsing, no more infection into that cavity. And you can see the only this much Kshar Sutra is remaining. And this is the finally completely healed fistula at the end of 6 weeks. Dear friends, we keep track of such patient having their address, mobile number and contact number, and I wait maximum for 1.5 years to 2 years for patient to come back to me with any complaints of recurrence. After 2 years, if patient comes, I don't hold it true recurrence. If patient has to come within 1 year, I will label it as a recurrence. But if within 1 year or 1.5 years patient doesn't come out, my postgraduate team keeps track record of these patients with date-wise Kshar Sutra change and everything and mobile number. And finally, we call and ask the patient to report after 1 year, and we take photographs so that any complication or any recurrence is avoided or reported and accepted. So that's why promotion and propagation of lesser known parasurgical procedures, Lekhan Karma, this Kshar tail did the Lekhan Karma and the tail did the Sandhan Karma, that is healing process. It worked. Varmalogy or Marma Chikitsa, I'll be talking to you in my later slides again. So what are the possible ways to promote such karma? As Varshney sir said that 50 years back, in India, when even Ayurveda doctors were not aware of such parasurgical procedure are there, which are having great success if done in a proper way. Same scenario is there for other parasurgical procedure. People are very happy and practicing happily Kshar Sutra, Raktamokshan, Agni Karma, Vidya Karma now. But then these lesser known parasurgical procedures should be popularized. Now, what are the possible ways to promote this? One way is through academia, through established health services, and through research authorities. In academia, undergraduate students should be encouraged to attend such webinars, conferences, and panel discussions, to go on the YouTube and use the internet to find out a greatest, a smallest research work being done in various institute. Now the abroad of Ayurveda is popular. There are institute abroad working, especially in European countries. They are working on Ayurveda, believe me. I'll be giving evidence again in my next few slides, how Ayurveda is popularized and how scientific work is being done abroad on Ayurveda. So undergraduate student should be trained and should be allowed to have an inquisitive mindset. उनको उसी उम्र में, उसी स्टेज में inquisitive mindset उनका डेवलप कराना चाहिए. Of course, PG students should be rigorously put to work for record keeping, documentation, photography and research work, and PhD level कोई excuse नहीं, यही काम करना है. So in academics, this clinical training and confidence building should be carried out through these various stages. And of course, innovation, always encourage the student to have a innovative mindset, inquisitive mindset, and you need to have a very extensive training in this field in the academic area. Now, as I said earlier, in academics, when you allow an extensive training, then you have to teach the student to speak the language the world understands. Now the world understands the language of science. बार बार हमारे आयुर्वेद वाले बोलते हैं कि भाई हमारा आयुर्वेद तो बहुत सिद्ध है, पहले से बोला हुआ है, but then you have to convert it into the language the world understand. जिस तरह डॉक्टर वार्ष्णेय सर ने अभी बताया that Professor Dr. Pandey is working scientifically. He is measuring the heat transmitted during the Agni Karma. Like Dr. Varshney sir said, that while leech application, they studied the leech saliva. They isolated few of the component in the leech saliva, and the fact came in front of the world that leech saliva contains a substance called a hirudin, which doesn't allow blood to clot. It was a major contribution into the scientific work. Ayurveda had already said this, but then they spoke into the language the world understand. So you have to train youngsters in academic area to speak the language the world understand. Dear friends, it's really pity that there is a lot of good scientific work, but it is unreported in proper flora. So reporting the proper work and publishing it is of prime importance in order to put forward our claim that our science has got an answer to the majority of elements. So good scientific works needs a very good documentation and good reporting at a proper flora, and our young budding doctors, postgraduates and research workers should be trained for keeping such scientific work reporting. Documentation of work, be a photography, videography or language, everything, these people should be trained in documentation of work. And as I said, is publishing and presenting at a right forum is very important, so that it will be appreciated. And the day is not far that our young Ayurveda practitioner will get a good recognition internationally and will receive a great admiration and awards also for their good work. Now, as I said, academic was one field. There are established services like medical officers who are postgraduates, or there are medical officers because of reservation in service candidate, they are doing post graduation. So these medical officers should be encouraged to have their health centers to implement some of the Ayurvedic treatment modalities, parasurgical procedures which are established, or parasurgical procedures which are underway of scientific work. So these medical officers should be encouraged to have a great say and work into this. Rural peripheral area where the herbal medicine, the herbs, The other Ayurveda material are available in abundance. Now वार्ष्णेय सर, जलों का बंबई में हमको मिलना बड़ा मुश्किल काम हो जाता है. पहले मैं जब स्टूडेंट था तब 10-15 रुपए में एक जलोका मिल जाती थी. When I became a teaching faculty, it jumped to 25 rupees to 30 rupees. When I became a senior teacher now, it goes to 100 rupees. Now 500 rupees देने पर भी जलोका नहीं मिलते हैं. But in rural area, it's available in abundance. जलोका, one example I am giving you. Be it अवचूर्णन, जैसे मैंने गोरखमुंडी के बारे में कहा, नीम के बारे में कहा, other even क्षार. We don't get a quality क्षार. मेरे को मेरे स्टूडेंट को इगतपुरी तक भेजना पड़ता है, पोदार वालों को. सैटरडे संडे ट्रिप निकालो, जाओ क्षार लेके आओ, जाओ स्नूही क्षीर लेके आओ. आई एम नॉट गेटिंग. सो इन रूरल पेरीफेरी जो सेंटर्स हैं, मेडिकल इंस्टीट्यूट्स हैं, वहां पर उनको एनकरेज करना चाहिए. प्राइमरी हेल्थ सेंटर्स आर रियली सच फोकस्ड एरिया वेयर द मेडिकल ऑफिसर्स इन चार्ज ऑफ प्राइमरी हेल्थ सेंटर्स शुड बी एनकरेज. एंड ऑफ कोर्स जनरल प्रैक्टिशनर, मैं जनरल प्रैक्टिशनर को हमेशा बोलता हूँ कि आप जो अगर जीपी करते हो, 10 से 20 पेशेंट नॉर्मल सर्दी, खांसी, जुलाब, पेट दर्द, उल्टी इसके आएंगे. 20 में से एक पेशेंट ऐसा आएगा कि तुमको सर खुजाना पड़ेगा ट्रीटमेंट के लिए. एंड हियर यू कैन अप्लाई द आयुर्वेदा. हियर यू कैन अप्लाई आयुर्वेदिक प्रिंसिपल. हियर you can apply herbal medicine and you will get the result. So general practitioners should be encouraged to have a Ayurveda practice in exceptional cases. Ayurveda practice where they are not getting answer to the allopathy medicine. And general practitioners should be encouraged to attend such seminars, webinars, panel discussion, and they should be encouraged to have an internet study on this issue. And this is how you can. Research authorities, which are Central Council of Research in Ayurveda Siddha, CCRS is apex research body of our country, and they have got branches and offices, and research work is also going on. They have got projects, and they have got extramural study projects for the people who are practitioner, who are in other academic institute. Go on the CCRS website and you will find lot of opportunities to work through CCRS. ICMR is a apex body of modern medicine, but they are also open for collaborative study, collaborative research. You go on the ICMR website and जो हमारे सामने चित्र है ना कि एलोपैथी वाले आयुर्वेद को अपोज कर रहे हैं, उनको पसंद नहीं आ रहा है, ये सब झूठ है. The genuine workers, true scientists are open, and in people in ICMR are ready for a collaborative study. Universities, various universities. I was in Karnataka for one conference, and there is Rajiv Gandhi University of Health Sciences. Our own Maharashtra University of Health Sciences has got an interdisciplinary research body. They want to have a collaborative research through Ayurveda, through homeopathy, through Unani, through allopathy, everywhere. So universities should be approached for such work. Go to university website and you will find such a lot of opportunities for interdisciplinary work and research work. So these are the areas you can work through. And one last parasurgical procedure I'll be showing you is Uttar Basti. Uttar Basti is a procedure where a medicine, a medicated liquid or a medicated oil is pushed through per urethra, retrograde. Urethra से ये medicine push किया जाता है, and this Uttar Basti is described in Shashti Upakram by Sushruta Samhita, way behind. And my colleague, as I said, it's a retrograde administration of medicated oil. Dr. Vinay, we have time, I believe. I'm not exceeding.
Yes, sir. You have time, sir.
Yeah, okay, thank you. So, as I said earlier, Uttar Basti is retrograde administration of medicated oil or medicated liquid per urethra. The oil or the liquid depends on the condition the patient is suffering from, and the surgeon, the Ayurveda surgeon who is treating it, is his choice. But we need to have a proper combination of this drug, and you have to follow all antiseptic and operative SOPs procedure for administering the Uttar Basti. Believe me, this is not specialization, this is a super specialization. Because if not done properly, it can cause profuse bleeding, it can cause burning, it can cause infection. And while doing such work, Dr. Vinaya and Dr. Shilpa, we have faced all these problems. We have faced all these complications. We have treated. I am quite frank here in accepting my shortfalls, my mistakes. And because of these shortfalls and mistakes, the complications we faced during this Uttar Basti program. One of my colleague, Dr. Amil Kantwar at Nanded Government Ayurveda College, and his student, Dr. Narayan Shahane. His student means Dr. Narayan Shahane has already past, I think, more than 8-10 years back, and he is practicing somewhere in Gujarat or Surat, and he is now famous as Ayurvedic urologist, only working on Uttar Basti. Dr. Amil Kantwar, to his credit, he has done, I think, more than few thousand of patients on Uttar Basti. Here I am showing you one retrograde urethrogram and having stricture at 2 levels. Urethral stricture. You can see urethral stricture in urethrogram. Now, this urethral stricture condition is a very difficult to treat condition. Ask any good allopathy side modern urologist, and he says, "Arey yaar, urethral stricture is a big pain," because surgery is the only option where they do the urethroplasty. How they do urethroplasty? They remove the buccal mucosa, or they get a mucosa from somewhere else. They remove this urethral mucosa and they implant the another mucosa here, and surgery is being done. And success, recurrence rate very high, success is very low. High success, and you have to do a regular periodic urethral dilatation. Even after doing urethroplasty, the urologist tells patient, he trains the patient that do the self dilatation. हफ्ते में 2 बार 3 बार urethral dilatation करते रहो और तुम ठीक रहोगे. That's recurrence rate. And the answer is Uttar Basti. You have to, this oil and medicated oil. Dr. Amil Kantwar is using various formulations, additions, subtractions. The Uttar Basti material starts from plain tirtel to tirtel mixed with honey, that is madhu, shahad. Then tirtel mixed with sendhav lavan. Tirtel mixed with sendhav lavan and honey. As per the condition, as per the progress of the stricture, we do the combination, subtractions, additions of these herbal preparations, and we do the Uttar Basti. So this is the pre-Uttar Basti, and after several administration of Uttar Basti, you can see the one stricture totally gone and still one stricture remaining here, but other stricture is totally gone. You can see a very good urethra, but there is still one stricture is remaining. So if you keep on giving the Uttar Basti, the Sendhav Lavan, the Madhu, does the debridement. What I did is some parasurgical procedure does the work of surgery. ये surgery हो गई debridement की यहाँ पर, chemical debridement हो गया ये, and oil will allow it to heal. व्रण रोपण प्रक्रिया oil से होती है, that is being done. That is the power of Uttar Basti being done. A very good scientific work is being done. It is already reported on international journal, etc. And these names which I have shown you are good name in and having a contributory work in Uttar Basti. And lastly, let me talk little bit on Marma Chikitsa. Friends, as you all are aware, especially academics, that Marma Gyan and Marma are really well described in our Samhita. What is the constitution of Marma? What are types of Marma? Sadhyo Pranahar Marma, Kalantar Parma Marma, Vaikalya Karma, etc. And its location, where these Marma are situated into the body. These are well described, but I did not find any substantial therapeutic application of this Marma. In Samhita, we hardly get any descriptions where the Marma are used for the treatment of a disease. Therapeutic application. So it has got a very huge potential of Marma Chikitsa. It's a potential in analgesia, musculoskeletal disorders, neuromuscular disorder. It's an untapped area, dear friends. And let me tell you that me and Kadri sir, we attended a 1-week training program of Marma Chikitsa in Bangalore. There is one Tamilian scholar, Dr. Shanmugam. He is expert in medical wormology. They call wormology. They call worm, not marm, in South India, in Tamil Nadu. And Dr. Shilpa, you should note, Dr. Shanmugam is not a medical doctor. Dr. Shanmugam is not an Ayurveda scholar. He is a professor in Tamil language in one of the university in Tamil. While completing his PhD, he stumbled upon 12th century manuscripts written in Tamil. And these manuscripts written in Tamil were about Marma Chikitsa. So he studied Ayurveda, he studied the Marma Vigyan, and he studied these manuscripts. He devoted several years for this, and he established medical vermology. Not only that, he has got thousands of patients being treated with the Marma Chikitsa, and now he conducts training program for doctors. And me and Dr. Kadri sir attended such 1 week workshop in Bangalore, paying some 7 or 8,000 was the fees. We had to take a residence in one of the Ayurveda Institute, accommodation, and we attended this. But 1 week training program I found was not sufficient because the language barrier was a big barrier. Already Dr. Vinay and Dr. Shilpa, you know, we are poor in Sanskrit language, our own language, but we are poor in it. So Tamil का तो अभी क्या बोलूं आपको? And Dr. Shanmugam, he speaks very less English. He speaks Tamil, but one of his friend, he's engineer, but he has trained himself in medical vermology, Mr. Suresh. He speaks English well, and we get, so these books are available on Amazon. The scholars can refer these books. I attended this 1 week, I read the book, and I am trying to implement Marma Chikitsa at my OPD, but it is in budding stage. But I am getting very encouraging result in cervical and lumbar spondylitis, spondylosis cases, in frozen shoulders, in patients of musculoskeletal disorders, neuromuscular disorders. In my workshop, they brought, in my workshop I attended in Bangalore, they brought some children, MRCP cases, having wonder results. Their parents cried that मेरे बच्चे को चम्मच हाथ से उठाना नहीं आता था, मेरा बच्चा ठीक से मुंह में अनाज नहीं डाल सकता था. With Marma Chikitsa of Adhipati, Sthapani, they call Marma massage, these children improved a lot. And now once in a year or twice in a year, they organize a camp inviting such patients. Not only that, memory enhancing, brain power enhancing procedures are being done with the only Marma Chikitsa, and that is known as a Marma massage. And they do Marma massage with very delicate finger. It's not a very harsh, ताकत से powerful massage किया हुआ नहीं रहता है. So Marma Chikitsa is extensively being done, therapeutic use of this Marma massage, and its clinical application, dear friends, put your mind to it, devote some time, study it. It has got a wonderful result, and I feel it has got an emergency utility, life-saving utility, where the I think one of the Kamal Hassan movie, I don't remember, I think Hindustani or some name was there. In that, the Marma decapitating a person and again bringing him back to normal position was shown. Of course, it was a cinematic presentation, in heroic act was shown. But if one enters into this and becomes expert, there is no day away where the emergency use of Marma massage and Marma Chikitsa can be done. That's what my feeling is there. It is another parasurgical procedure we can use. And whenever I do this talk, I do my presentation, I show this photograph. This is a 10 or 12-year-old photograph when I was invited to London International Conference of Indigenous Medicine, and I had presented my work on leech application. There I met Professor Dr. Kenji Tazawa. And when I did my presentation, his secretary, a young, beautiful Japanese lady, came forward and said, "My boss wants to meet you." So I went and I was introduced to Dr. Kenji Tazawa, and he said, "I was very glad to see another good procedure of leech application, and you are an expert of leech application from India. I am an expert on Shar Sutra from Japan." I was surprised and taken back. I said, "What?" He said, "Yes, we are doing Shar Sutra expertly in Japan." And he said, "Please sit with me." So we sat down, and he said that Japan does not originate any idea. Japan do not produce anything good. The originally car was invented in Germany, but the best car in the world is Japanese car. We did not invent camera. Camera was invented one European Camry in a European country, but the best camera available is from Japan. We did not invent Shar Sutra. But wait, Dr. Solanki, for a few years, the best Shar Sutra available internationally will be from the Japan. So Dr. Vinaya and Dr. Shilpa, young generation, be aware, they are coming fast towards us. और वो दिन ज़्यादा दूर नहीं है जब आपको आयुर्वेद सीखने के लिए जापान जाना पड़ेगा. So please wake up and start doing scientific work, and let us do a good work showing to the international scenario. Thank you very much, SMBT Ayurveda College, for inviting me and sharing my views on this work. Thank you all.
Thank you, sir. You have beautifully. Thank you, sir. Thank you very much, sir. You have beautifully one by one thrown light on many unknown areas of parasurgical procedures, apart from Agni Karma, Kshal Sutra, and Rakta Moksha. With your clinical experiences and evidences, which are very important for us. This will inspire to us and our students and upcoming practitioners definitely. Also, sir, you have given the message to us to popularize and honestly work on the Ayurveda field to make it popularize, and it means a lot for us. We will keep it in mind forever. Thank you, sir. Sir, I want to say just 2 lines, but it is essential to speak. Hence, I am going to share the 2 lines without protocol. Sir, apart from subject knowledge, which was the best at level, I will like to appreciate the 2 thoughts you mentioned. The first is language that world understand, we should work upon. We should report the proper work and we should publish our proper work. This was the first thought, and the second thought was, sir, we have selected this topic as a super specialty only. At that level, your thought and our thought was matching. Hence, I just want to mention that we also selected this topic as specialty, not a specialty. I want to share these two thoughts, and very much thank you, sir. It was very much nice presentation. Now, Vinaya. Now, as Solanki sir suggested, I would like to request Dr. Vashnya sir to give your expert opinion. So, Vashnya sir.
Guruji, बोलिए.
Congratulations, Dr. Solanki sir.
Thank you, sir.
बहुत ही बढ़िया आपने जो है एक क्या बोलना चाहिए उत्तेजक, सभी के लिए प्रेरणादायक एक बहुत ही अच्छा लेक्चर लिया, और निश्चय ही आपने जो शुरुआत करी, षडमूलो अष्ट परिग्राही पंच लक्षण लक्षिता षष्ठा विधाने निर्दिष्ट, 60 प्रोसीजर्स हैं ठीक करने के किसी पैथोलॉजी को आयुर्वेद में बताए, और आपने जो जनरल लीग से थोड़ा सा साइड में जाके अपना जो योगदान दिया है इन 60 उपक्रमों के विषय में, निश्चित इट विल वेरी यूजफुल टू कमिंग जनरेशन. डॉक्टर विनय, डॉक्टर other fellows, the principal, etc. They will, I think, keep this idea to propagate these procedures. Like first, you have tried to tell something about aptarpan, which is a very important therapy in Ayurveda. बताया गया है कि भैया अक्षी कुक्षी भवे रोगा प्रतिष्ठाय व्रणज्वरा, ये जो बीमारियां हैं इसमें बहुत सी एलर्जिक है, इन्फ्लेमेटरी है, मेटाबॉलिक है, पंचरात्रे 5 दिन लंघन करने से ये ठीक हो जाती है, कंट्रोल हो जाती हैं या इंप्रूव हो जाती हैं. तो मेरे ख्याल से बहुत ही अच्छा रोल है अपतर्पण का. और यू हैव गिवन एग्जांपल, 2 एग्जांपल, पेरीवर्टेब्रल एब्सेस एंड द पेरिएनल एब्सेस आल्सो. So in my experience also, if a person develop in initial stage, if you control his diet and put him on the langan or a light therapy, this light food therapy, their pathology can be controlled easily in early stages. So it is a very good therapy, aptarpan, a very good therapy. As regards the lekhan, you have mentioned so many things about the lekhan. तो भैया जब तक खुरचेंगे नहीं, जब तक स्क्रैपिंग नहीं करेंगे, अशुद्ध व्रण जो बताया भाई, पूत पूयास्रक बहुश्रावान महारुजा, ऐसा यदि व्रण आ गया है तो फर्स्ट जो है उसको जब आप लेखन करेंगे तभी ना आराम मिलेगा, तभी आप व्रण तो अपने आप भरता है, लेकिन व्रण को वातावरण बनाना, द एटमॉस्फियर, इट इज बाय लेखन कर्म. और आपने बताया कि भैया छार से आपने लेखन कर्म किया, 3-4 दिन बाद बायोफिल्म बन जाती है, ये भी आपने बताया. Streptococcus, is a scientific study. It will be certainly very useful in coming generation. They will take advantage of your research, and I think it is a lesson to a budding surgeon, budding person, to how to do research in the field of the surgery. Then regarding the other therapy, like you have mentioned the Abchurnan also very good. Gorakhmundi, it is very effective. I am surprised that single drug can so much be effective. Very good. One of my colleague in Wardha, Dr. Thakre, is doing a single drug study on the wound, and that is a, you might have not heard the Khantu Chakka plant. It is not mentioned in Ayurveda text. The Khantu Chakka plant is very, very effective in most of the wound condition. Most of the healing start by the Khantu Chakka plant. Khantu Chakka tel they have mentioned. Anyhow, it is very good. I think I congratulate you for all these things. You have mentioned another very important thing, the char tel. I have also very मतलब बहुत अच्छा अनुभव है मेरा भी. The person who is teaching on the चार सूत्र, ये कहना बहुत गलत है कि चार सूत्र से भैया सभी ठीक हो जाते हैं, कॉम्प्लिकेशन नहीं होते, अनडिजायर्ड इफेक्ट नहीं होते. जो person who are doing the practice in the चार सूत्र therapy, they might have been known that few cases are remain challengeable even after doing चार सूत्र. I have many cases from the different, they are treated by different person, different friends of mine. But when the recurrence or rather you can say non-healing problem was there and it was cured but improved by the chartel only. It is very good important in the management of the chronic the fistula which are not healing by traditional ways. The other thing which you have mentioned very good about the Basti therapy. The Amar Kantiwal is also a very good friend of mine. He came to Wardha, he demonstrated his therapy. I was very much impressed. Then his student, one of the students of yours, I think Dr. Bharti, now she is in Akola. She has started this Basti Chikitsa in stricture urethra. And I'm surprised, a lot of patients from this stricture, they come to Dr. Bharti and she treated her by this Hartal only. So it is very important field to do a research on the coming generation. My experience another, the chartel in the stricture urethra also, the stricture rectal stricture is also a significant role of the chartel. Another way, the chartel is found very effective in many conditions of the wounds. In Uttar Basti, we are using Uttar Basti in benign prostatic hypertrophy. It is very effective to treat the urinary tract infection and the BPH also. So it is also a field of the research to do coming generation to do a Basti Chikitsa in BPH therapy. As regards the मर्म चिकित्सा, ओहो ये तो मर्म की बात है, बड़ी गहरी बात है, बड़ी अच्छी बात है. So मर्म चिकित्सा now it is started. Every part of the person now is they are very interested. Dr. Himant from the Jaipur is doing the मर्म चिकित्सा. Dr. Sunil Joshi is a vice chancellor of Uttarakhand University. He has written so many books about this मर्म therapy. And when he take the camp of the मर्म, thousand patients come to actually show him, and they are getting benefited just without any treatment. Maram Chikitsa is a very important field of the research as we described in Ayurveda. The Poddar actually institute is a very good institute, very old institute. It started with Dr. Avasti, Dr. Nagaral, then Dr. Lavekar. But your work, the other young generation has done so much work in the parasurgical measures or other measures which they were, I think, not done so much work in those time, maybe limitation. But you have again, झंडा ऊंचा रहे हमारा आपने झंडा ऊंचा उठाया है पोद्दार का. आने वाले समय में पोद्दार और आगे जाएगा और मैं अपनी शुभकामनाएं देता हूं सभी के लिए और स्पेशली डॉक्टर विनय जिसने मुझे बहुत कांटेक्ट किया, बार बार मुझे बताया सर आप आ रहे नहीं आ रहे, उस सभी को पूरी टीम को धन्यवाद देना चाहता हूं कि बहुत ही अच्छा उन्होंने आयोजन किया और मुझे 2 शब्द बोलने का यहाँ मौका दिया. बहुत बहुत धन्यवाद. थैंक यू वेरी मच.
धन्यवाद सर. थैंक यू सर. कैन यू गिव मी 1 minute?
Yes sir, yes sir.
वार्ष्णेय सर गुरु हैं और ये उनका बड़प्पन है कि हमारे जैसे छोटे शिष्य को वो अपना मित्र और कलीग कह रहे हैं. ये इसके लिए मैं रियली उनका आभारी हूँ कि लेकिन कहीं भी हमारी इतनी ये नहीं है कि सर के बरोबरी या सर के कलीग बने. हाँ, आई वुड रिमेन इंडेबिटेड थ्रू आउट माई लाइफ टू यू सर. थैंक यू सर.
हमारे यहाँ तो बोला इच्छात शिष्यात पराजयेत. गुरु वही है जो शिष्य से पराजय होने की भावना रखता है. और मुझे तो बड़ी खुशी होती है जब आप लोग आगे बढ़ते हैं और आगे बढ़ रहे हैं. आपके भी स्टूडेंट आगे बढ़ रहे हैं. इससे ज्यादा ग्रैंडफादर को और क्या खुशी होगी. ये तो बहुत अच्छी बात है. आने जनरेशन बहुत आगे बढ़ रही है. थैंक यू वेरी मच.
थैंक यू सर.
थैंक यू वेरी मच फॉर योर एक्सपर्ट ओपिनियन. सर आपके एक्सपर्ट कमेंट्स में भी आपने इतने सारे टिप्स दिए हैं which will help us in our life forever, sir. Even thank you, Dr. Solanki, sir. Now, Dr. Samudri, sir, is going to deliver
his speech today. He is busy anyhow tomorrow, so he requested us to join today only. So introduction will be given.
But for 10 minutes. Now we are very much glad to introduce the knowledgeable, dynamic, and kind-hearted personality in the field of Ayurveda, doctor and well-known personality in the Ayurveda. He is our guru also, Dr. M.D. Samudri sir. There is no need to introduce him, but as it is a procedure, I am going to introduce in a short words. Dr. M.D. Samudri has 15 years experience of teaching and training in surgery. He has invented Kshar Karma in Tundikeri, which is his unique contribution to Ayurveda and is remembered for. His research work on nanotechnology and polymers has given new dimensions in the field of Ayurveda. His contributions to clinical research are worth appreciation. His unique way of treating chronic ailments like ulcerative colitis, complex fistula, and anorectal disorders has attracted people across the world to the great Indian system of medicine, Ayurveda. I am requesting Dr. Samudri sir to please deliver your speech.
Thank you very much, Dr. Vinaya Bodke and Dr. Solanki sir, Dr. Vasne sir, and principal of the Ayurveda College. Thank you very much for giving me opportunity to share my views. So whenever I feel and I take the privilege to present whenever the Maharashtra people call me and give me an opportunity. And I always very happy and comfortable in Maharashtra than any other place. Okay. Thank you once again, Maharashtra, for giving me opportunity. So directly, so I have been given topic on this parasurgical procedures, this is Kshar Karma. So let me go in detail about the management of chronic tonsillitis, where it is surgically the Kshara Karma adopted and it is brought to limelight. And then I will show you some of the videographs where Kshara Karma is adopted successfully in Bhagandara, in Arshas, in Tundikeri, and in some other diseases where I do practice. So let me begin with the topic. So how much time is given to me? Let me check the time, and I would like to finish within the stipulated hours. So now it is 11:50. So I started 3 minutes ago, and let me start. Okay.
Yes, sir, sure.
So how much time you give, madam?
Sir, it's no limits. It's our pleasure to listen you, sir.
No, not like that, because whenever a teacher starts speaking, so there is no limitation for a teacher, because the audience should not be get bored, and I should not consume next speaker's time. So this is my aim of asking the time limitation. Otherwise, I don't mind speaking hours together.
45 minutes to 1 hour.
Okay. Thank you. So this is a commonest disease. Tundikeri is a common, and 7% of the patients, they are out of all the population, they suffer from this disease, because it is a very commonly affected to the children, especially below 12 years. So they do suffer, and 2 lakh children undergo tonsillectomy in India every year. It's a rough statistics I am giving you. It's not exactly, but around 2 lakh children undergo tonsillectomy. And tonsillectomy is not a solution every time. Of course, it is indicated, but there are some absolute contraindications also. Till the child attains 12 years, better you do not perform tonsillectomy, because this tonsil They are the lymphoid tissue. They are involved with the immune mechanism of an individual. Okay, they are involved in the immune mechanism. The child is going to develop the immunity. So if you remove that organ, so that immune mechanism, what child is going to attain, or the immunity what child is going to attain against the infectious organisms, so that is hampered. That is hampered, and the child becomes more susceptible for infections. We need to find out a better acceptable and easy procedure. So when I found the Ksharakharma to be adopted, so then it was adopted a parasurgical procedure in a surgical disease. So Pratisaniya Kshara is one among them. So these parasurgical procedures like Ksharakharma, Agnikarma, Rakta Mokshana, they are said to be the outstanding contribution of Acharya Shushruta, where a surgical disease is treated with these procedures, and a very good outcome or fruitful outcome is observed. Yes. So let us know what is this disease. Hanusandhyashritah kante karpasi phalasannivah. Okay, this definition is being told by Acharya Shushruta and Vagbhata both. So there is Hanusandhi, that is a Kantagata Roga. It is very clearly mentioned by Acharya Vagbhata that is a Kantagata Vyadhi. So there exactly this comes living about the controversy, you consider it as a Kantagata. So Karpasi Phalasannima. So it is very, very clear. If you see the Karpasa Phala, exactly it looks, and there is some depressions and these on the fruit. So in the inflamed tonsil, you get similar depressions. So these depressions are called as the crypts. So the crypts, and these crypts, sometimes that I will show you the photograph. The exact semblance of this growth is compared. So Nidana, to talk about the Nidana, Aharja hetus and Viharja hetus. Matsya, Mahisha, Mamsarasa, Mamsa, Masha, Dadi, Shira, Ikshurasa, Phanitra. So these are the excess consumption of this. This is going to cause the disease. So consumption, normal way, okay, but according to the season, and this is sometimes people say that सर्दी हो रात में आइसक्रीम खाने की मजा ही कुछ और है. But that is not a case. There is not a thing to be done. So once a while you take, okay, accepted, but repeated consumption, that is why it is being told excess consumption. Okay, repeatedly doing these things, they lead to the mukharogas. Okay, that is why it is told Anupashita Kshiradadi Masha Matsya Atisevana Mukhamadya Gadan Kuryaha Krutta Kapota. So this is one point I wanted to highlight here, because excess consumption of these things aggravate kapha dosha. Okay, so everyday non-veg, not that accepted. Everyday fish, not that accepted. Everyday consumption of milk and milk products. So milk, so again you need to make some modifications and eat. And at night you should avoid buttermilk and curds. Yogurt, especially yogurt. Some people are fond of yogurt. So yogurt, so if you have a little sore throat or clinical features of a common cold, and if you consume this yogurt or curds, so immediately after 10-15 minutes you start coughing, sore throat increases, and then it may lead to a viral fever. It may lead to a viral infection, and then you need to suffer from an upper respiratory tract infection. If you suffer from upper respiratory tract infection, it is quite obvious. In spite of taking treatment, some people go into the low respiratory tract. So better you avoid these things, and then so milk and milk products, so skimmed milk, toned milk, so which are refrigerated, cooled. So consumption of these also causes. and Ikshurasa Phanita. So they are having Shita Viryas, and they are also these Kapakaras. So these things we have to avoid. Along with this, so we come across this Danta Dhavana. So Danta Dhavana improperly carried out Kavala Gandusha exposure to cold. So these are climatic changes. So coming to the improper Kavala Gandusha increases this Dantadina Maladhyatvam. It increases the deposition in the oral cavity. And this deposition harbors the infection. It may be streptococci, or staphylococci. Okay. So these infections immediately they cause tonsillitis, because any infection oral cavity it enters, first and foremost organ to respond is tonsils. Okay, these tonsils they respond immediately, they undergo inflammation because it's a lymphoid tissue, and the immune mechanism starts, fever starts. So exposure to cold, there are two types of cold. So this tonsillitis or tundikeri is observed in rainy season. Its incidence is more in rainy season than in summer season or winter season. Okay, so we get two types of cold here. Meghamul Shitalehi, Pragvatalehi. In Tamakashvasa it is being mentioned. Megha Ambushitalehi, that is the cold weather in the rainy season, and Pragvatalehi, cold in the winter season. People who are living in this coastal area hardly they experience the cold of winter. So always there is a humid climate there. So that is not affected much. But that region is not affected. People like living in a Sadharana Desha, so we do experience all the seasons. All three seasons are equally there experienced. Place like in Gadag, part of Karnataka, place like in Gadag, we experience all the three seasons. So what we observe in OPDs also, so most of the time, this oropharyngeal diseases, infective diseases, they are more, or incidence of these diseases is more in rainy season. So this is about, and improper brushing, that is that type of avakshamya, adhomukha avakshamya. So if the person is having habit of sleeping head down position, okay, so this head down position leads to collection of the paranasal sinuses. They are not drained. So when there is a collection, so that this drainage is in the nasopharynx. Okay, nasopharynx, and this may also cause the oropharyngeal, nasopharyngeal infections. So this again leads to the diseases of the oropharynx. So one particular disease, Tundikeri, they have not mentioned the Samprapti or Lakshana. So you have to conclude, or you have to understand the common Samprapti and Lakshana. This Mukharogas also, Samprapti is not being told, only Nidana told. So that you need to bring a conclusion. And what are the clinical features according to Shushruta? Shofa Toda Daha Praguktabhyam Tundikeri Mata. Okay. Shofa Mandaru Katinas Tundikerika. This is what Acharya Vagbata has to. What Vagbata. Shushruta, what clinical mentioned. So they are more or less the acute acute tonsillitis lakshanas, and what Vagbata has told, so they are the chronic tonsillitis lakshanas. Pavan? Yes, okay. Now, what is the treatment available? So, let us see the treatment. Shastrakrita Chikitsa and Ashastrakrita Chikitsa. Ashastra Chikitsa Pratisarana. Pratisarana is Angushta Anguli Avagarshayat. You have to take a churna and either mixed with, it is mixed with the madhu or churna itself, that is gently rubbed over the area. Okay. Angushta Anguli Avagarshayat. You have to take the help of Anguli and or Angushta, then you have to gently rub this churna over that surface. That Pratisarana is one of the treatment. Dhumana, Kavala, Gandusha, Nasya. So these are different treatment modalities, local and systemic treatment, and medications also mentioned. And Shastrakrita Rakta Mokshana Chedana and it's a Chedya Vyadhi. It's a Bhedya Vyadhi. Some say it's a Bhedya Vyadhi, some say it is a Chedya Vyadhi. So that is why you can combine both the treatment, Chedana and Bhedana. Okay. So that is going to give you. And what is the medical management? These are the procedures mentioned. What is the medical management? Whenever the Tundikeri comes to my OPD, I never give antibiotics. I never use even the paracetamol also. Very rarely I use paracetamol. Otherwise, I get result with this. So I prescribe Vidangarista. Vidangarista, why? Vidangarista, I give the relevance of it. Vidang is having Ushna and Tikshna Guna. Okay, Ushna and Tikshna Guna. In Kafaja Krimi, it helps. Not all Krimi. Krimi Hara we say, but Kafaja Krimi, it helps a lot. So this we must keep in mind. So Tundikeri is one of the Mukharoga. Mukhamadya Gadan Kurya Kruddha Kafottara. So it's a Kafadosha predominant disease. That is why Kafaja Krimi we have to do. And in case of Krimi is one of the Krimi Upasarga is one of the cause for this disease. That is why Vidangarishta is. Then Amrutarishta. Amruta is Krimihara and Jwarahara. So this you give. Agni Tundivati. Agni Tundivati, that is what mentioned in Vaishajya, where this Agni Tundi contains the Vatsanava, Visha. And Visha is a Vedana Sthapaka, Shotahara. So that is why it reduces Vedana and it reduces Shofa. That is why Agni Tundi is used. So with this combination of drugs, I found very good result. And Khadira for Kavala. If Khadiradivati or Amodini Gutika, the compounds which contain Khadira is not available, then you can use Triphala, Choda, and prepare Triphala Kashaya and give it for Kargi. So that will help. So in spite of using medical medicines and following the Patya and Apatya, if this disease has not come down, then it leads to the chronicity. So disease becomes chronic, and the main cause for disease becoming chronic is improper use of antibiotics. Antibiotics are not properly used by the patients or prescribed by the doctor. If doctor has prescribed 10, then they take it 2 or 3. When the symptoms reduce, they stop. So this is very bad. So they do not complete the course, and as a result, the organism develop resistance. Or one day using one antibiotic, and the second day they go to another consultant and he uses another antibiotic, and again this use of 2-3 antibiotics, irrelevant prescription of antibiotics, irrational use of antibiotics leads to the disease chronic. And this chronic we have acute this types, and then these are types here. Then disease becomes chronic. So chronic, that is chronic fibroid tonsillitis, chronic parenchymatous tonsillitis, chronic follicular tonsillitis, and complications like peritonsillar abscess. It is also called as quinsy, where the patient is unable to open the mouth. So we call it as a trismus. Okay, we call it as a trismus. And in anorectal, when it's a painful defecation, we call it as a tenesmus. So there are a lot of similarity, but the anatomical site changes. One is at top and one is at a bottom. And tonsillar cyst and acute otitis media. So this is a referred pain and a referred nearby adjacent organ. So that also there is a chance of acute otitis media. Okay, acute nephritis, rheumatoid fever, diarrhea, and appendicitis, calculus of the tonsil. So these are other complications. Okay, so when the organism enters the systemic or digestive system, then and enters the systemic circulation, then it may cause the nephritis, rheumatic fever, diarrhea, appendicitis also. And tonsillar lith, it is a very painful condition when there are crypts are filled with a pus or a cheesy material, and the antibiotics are given, so they get calcified. And this calcification. This calcification is very, very painful condition. You need to carry out surgery for it, and surgery also sometimes, if partially removed and it is left there itself, then it is really a very painful condition and pitiable condition to the patient, and even surgeon is also helpless. And retention cyst of the tonsil, supratonsillar cyst, infratonsillar cyst. So we come across the retention cyst of the tonsil. So this is also one of the complication of. Yes, I will explain you the types of this. So this first left side of the slide, you can see this is the chronic follicular tonsillitis. The crypts here, they are filled with a cheesy material. You can see on the surface of the tonsils, it's oozing out. So this we call it as a chronic follicular tonsillitis. And often this tonsillitis is associated with the main symptom as halitosis, that is the bad breath, halitosis. And along with the size of the tonsil is increased, the fever with chills. So all the signs of inflammation, they will be there. Okay, yes. And this is one, it's a parenchymatous tonsillitis. This is a parenchymatous tonsillitis. Almost the tonsils are very enlarged, very big, huge, and almost they are kissing together. They are called as kissing tonsils. They are called as kissing tonsils. And the parents are worried for this type of tonsillitis because the size is visible. The huge size is visible. And because of this visibility, they are worried. And hoarseness of the voice. And child talks, there is a hoarseness of the voice because it interferes with the production of the speech. So there is hoarseness of the voice. So this is parenchymatous tonsillitis. And this is fibroid tonsillitis. You can see there is a fibroid tonsillitis. The size of the tonsil is not much enlarged. It is regressed. It is not that enlarged, but there is a recurrent infection. This is a danger variety because the size is not enlarged and parents are not worried, and patient is also not worried. So this leads to the chronic and recurrent infection, and it is associated. You can see the pharynx here. It is associated with the pharyngitis. There is a nodular pharyngitis. You can see here also there is a nodular pharyngitis. This is very clear visibility here. There's a nodular pharyngitis. So this tonsillopharyngitis, this phenomena we call it as a tonsillopharyngitis. And this is a catarrhal tonsillitis where a thin membrane, or is also called as a membranous tonsillitis. A thin membrane is formed over the tonsil surface, and this we call it as a membranous tonsillitis. So let me tell you about Kshara here very briefly. It's not a Kshara Sutra, it is a Kshara. Kshara is collected in a Panka form. To prepare Kshara Sutra, we manufacture Kshara in a Churna form. So that is the Mrudu Kshara we use for this preparation of Kshara Sutra. This is a Pratisarniya Tikshna Kshara. Okay, so it is a Panka form. कीचड़ के जैसा रहता है, पंख form. You can see, and this is a test for perfectness. So this is Eranda, and its stalk of the leaf is peeled off, and then it is immersed in the Kshara, and we have to count for 100. Shatamatra Kala. After Shatamatra Kala, you can see the color change. You can see the color change here. So this is the appropriate Kshara which you can use, and its ideal pH is 11 to 11.2. So more than 11.2, it is highly alkaline and it causes corrosive effect. When you prepare the Kshara, so you keep it for 2 months and don't use it. When you keep it for 2 months, and then its pH reduces little, and it's ideal to use. So what in my experience, what I have seen is soon after preparation of Kshara, immediately please do not use it for Kshar Karma purpose. Yes. Next slide. So these are the materials which you require to do the Kshara Karma. So bull's eye lamp, not necessarily, but headlamp is there, then you can use. Or if you have a adequate or if you have good number of assistants, then you can use. So there is no sharp instrument used here. No sharp instrument. A curved artery forceps is there, lignocaine 10% spray, peanuts, tongue repressor, and a sharp. So only this is sufficient. These many instruments sufficient. And you need a kidney tray and peanuts you need to prepare. Lemon juice you require. And better you use a curved artery forceps. Okay. Gloves, mask, cap, all those things. That is no need to tell for a surgeon operating surgeon, but you can use. So this is what a group, a clinical trial being conducted that, and this is Purva Karma, Pradhana Karma, and Paschat Karma. Okay. So what Purva Karma? You have to keep the patient nil orally. That is very, very absolutely needed. Other than that, what you take a consent, you take written consent, you carry out some investigations. Those are all common. Everybody knew it. But for students, you need to know them, you need to learn and adopt. Okay. And very important is keep the patient nil orally. Okay. Mudagarbha, Arsha, Udara, Bagandara, Ashmari, Bagandara, Mukharogeshu, Abhuktavata Karma Kurvitaha. It is being mentioned. These are the sites, these are the diseases in these areas. Mukharoga is also included. Arsha, Bagandara. So all these things you need to keep the patients nil orally. Other than these sites, you can give little food and carry out. Or it depends on the area where you are operating, and it depends on the post-operative care. So based on that, you can keep the patient nil orally, or you can skip the patient. You give little food and you can carry out. But this oral cavity, oropharyngeal surgeries, you have to keep the patient nil orally. Minimum 6 hours starvation is essential. So why? Because it's a site for Veda Pradurbhava, Charti, Chavatu, Kasa. So all these come through the oral cavity. And while doing procedure, if patients vomit, if food is there, if you little stimulation or stimulation to the oropharynx triggers vomiting and patient vomit. And the entire temper of the procedure is altered. Okay. So then Pradhana Karma, Paschat Karma, and anesthesia. So anesthesia here, so far, I have not even 5-year child also. I have children. I have done under local lignocaine 10% spray. I do not use general anesthesia, not even sedation. And my preferable position is sitting position. I am comfortable in sitting position. Okay. So if child is in, some of my colleagues, they have carried out in general anesthesia when the child is not cooperative with this and that some reason they have told. But what I have conveyed, I have convinced and counseled the children and children's parents about the procedure, and they are very cooperative. Very rarely some patients we do not cooperate. Then Samopaya, Bedopaya, Dandopaya that we use, I call it as a vocal anesthesia. After local anesthesia, vocal anesthesia is equally important. Otherwise, it will not be successful procedure. Okay, position. If you do under general anesthesia, you use rose position. Or if you do under local anesthesia, then you take a sitting position. Okay. So this is what the Purva Karma. Purva Karma, just the mucosa of the tonsil surface you have to scrape. Just gentle scrape with the ear scoop you can use to scrape it. And then first you have to spray lignocaine, and then you have to do the spray. After the lignocaine anesthesia or local, the part is anesthetized, then you can use the scoop for just ear scoop just to scrape and make the mucosa clear. Okay. and then you take the kshara in the peanut surface you take, because if you apply kshara and leave it, it may spill down. If it spills on the vocal cords, if it spills directly on the esophagus, so immediately it causes the erosion there. It causes wound, and that may be a vocal cord injury, may be a permanent change in the voice. So to avoid that, you take the kshara in the peanut, and that you touch with the tonsil surface, and you can count for 30 seconds or 30 to 40 seconds. Keep it for 30 to 40 seconds, and then you can take it back. And once you take back, then you take lemon juice again in the cotton peanut and then apply over the surface. So why you have to apply the lemon juice? So you need to carry out the procedure for the tonsil surface. And kshara is having the property that it will penetrate deep into the tissues if you apply on the surface of the tonsils. This is a very good property of kshara. If you apply kshara and after 30 seconds, it will below that, if you cut the tissue and below that also it will enter. It's the action you can see. So you have to neutralize it. So to neutralize the action of the kshara, you have to use the lemon. That is kshara and this is acid. So Acharya Shushruta knew the action of alkali and acid. So when they are brought together, so they give light to the salts and water. So they get neutralized. Both acid and alkali, they are brought together or mixed together. So this Shushruta, very basic action of this alkali and acid, Shushruta has mentioned, Rasena amlena, Tikshna Viryoshnena, Agneya Agnenam, Katam Sharaha Prashyana. So Rasa, Amla, Tikshna Virya. Tikshna Virya it is having. But even though it is having Tikshna Virya, Agni like what this Kshara is having property like Agni, so that is also subsided and brought to neutralization. So this is a very basic reaction Acharya Shushruta has told. So that is why I tell many times there is a lot of chemistry used in Ayurveda. So we fail to understand this chemistry and we do not highlight this chemistry. Probably this is the reason why BAMS admission is made compulsory after studying physics, chemistry, or science. For science students, it's being made compulsory. Yes. Then you have to apply lemon juice. Once the lemon juice is applied, it looks like this. Not very clearly the color change as you see in Arshas, that Pakva Jambu Phalaprati is not seen. Highly vascular tissue, you get a Pakva Jambu Phalaprati, but here little reddish brown color is seen. Then post-operative management. So you have to avoid hot and hard food substance for 3 to 4 days sufficient. Estifandu Fanta mixed with Grita for gargling thrice daily for 7 days or 10 days you can use. And orally you use Estimadu Chona, Amrita Sattva, Kamaduga Itmoktika. So this I give, and in spite of this, if patient is having pain, you can use some painkiller like ibuprofen or you can use paracetamol. And what the symptoms which we can analyze and how the result is brought scientifically, that the statistical inference I would like to tell you. Dyspnea, it increases. Suddenly the pain increases. You are doing a kshara karma, and after kshara karma there is a wound, and this wound is having a tremendous pain, or pain is experienced in a tremendous quantity amount. So that is why dysphagia increases for first 3 years and gradually it subsides. Sore throat, that also subsides gradually. Halitosis for follicular tonsillitis. Halitosis increases because the crypts open wide and all the cheesy material or pus or whatever the debridement is there, it comes out. As and how it comes out, the smell also increases. So dysphagia, pain also increases. Pain is very throbbing type of pain. Very difficult to manage the pain. Okay, you have to give the injections. Those who are not having pain tolerating capacity. Some people I have seen having lot of pain tolerating capacity, they require very less amount of analgesics. Hyperemia, the surrounding tissue becomes inflamed and edematous, and as and how this you do gargling and gradually it comes. As and how the wound heals, subsequently it hyperemia also comes down. And size of the tonsils. See, size of the tonsils, I want to be very precise here. You are not cutting the tonsils. The size in parenchymatous is not completely regressed. Other type of chronic tonsillitis, its size regresses, no doubt. But in parenchymatous, around half of the size reduces. Remaining, it remains as it is. And but tonsils are there, but it prevents the recurrence of the disease. It prevents the recurrent infection. So, and enlarged lymph nodes. Enlarged lymph nodes, as and how the size of the tonsil is reduced, preauricular, postauricular lymph nodes are enlarged. So these enlarged lymph nodes also, they come down. They also come down. So this is what, and this is the improvement of the cases. This I want to tell you. These results. So I have told almost along with the symptoms only, I have told what happens to this hyperemia of the mucous membrane, enlarged tonsil, pain, everything I have told. And always give the assurance that enlarged tonsils will not completely go. So parenchymatous, if there is a recurrence of the disease, you need a second sitting of Ksharakharma after 2 weeks or 3 weeks. Plan it after 3 weeks. Don't plan earlier to 3 weeks. And some patients come and force you to do the procedure. Don't listen to the patients. You follow which is ethical. You can see this is a boy who underwent Ksharakharma. Before Ksharakharma it is. And after Ksharakharma, you see the size has reduced. It is a parenchymatous tonsillitis. And now this boy has become an adult. Now he is 26 years old, 26, 27 years old. And till now he is not, there is no recurrence of this. Of course, there is recurrence in the sense here, there is a sore throat, there is a pharyngitis, but there is no tonsillitis. So when there is a pharyngitis or a common cold, or there is a coryza or viral fever, they do say, again I got a tonsillitis. When you examine, you can see there is no changes in the tonsil surface, but there is a pharyngitis. There is either it may be nodular pharyngitis or whatever it is that you treat a pharyngitis. Okay, this is what you have to inform and educate the patient and patient attenders that what is going to happen. Otherwise, if you do Ksharakharma and if pain increases and if you are not available and they go to some other people who don't know this procedure because it's a new procedure and they say there's something is applied and there is a wrong thing is being done to you, you get admitted and will do surgery. They say like that because this procedure is not known to many people. You have to make it popular by practicing. You learn it and then you do practice. Okay, yes. So this is what then how it is going to prevent the recurrence. So this is, I have studied a histopathological tissue study is being carried out. You can see this is a lymph channel, sorry, it's a lymphatic tissue, lymph channel, you can see a channel. So these channels, there are some sub channels are there, small channels, they come and this is the main stream of the channel. You can see this is when the tissue is infected before treatment. There is segregation of the cells are dissociated because of the inflammatory process, and after Ksharakharma, when the wound completely healed, so these are the lymphatic channels, they are very clearly visible, small channels, they are joining here. This is the main stream of lymph channel. So it comes here, everything comes and it gets drained here. So there is aggregation of the lymph tissue. There is aggregation of the lymph tissue and there is no blockage of the lymph channel. if there is a fibrosis, there would have been a blockage of the lymph channel. This is the beauty and speciality of Ksharda. There is no blockage of lymph channel, only the aggregation of the lymph tissue. So this is what, and this aggregation makes and it prevents the recurrence of the disease. So it reduces kapha dosha. Krimyam kapha kushtameda samupahanta. Shushruta has to, Acharya Shushruta has to. Local application and systemic administration of Kshara, it reduces kapha dosha and it kills krimi. And then it does chedya bhedya lekhe karana. Tridoshagnat. Chedana and bhedana it does. So chedana and bhedana, they are understood in terms of lekha. It is not sudden, it is going to cut and the tissue is going to fall down. Not like that. So it is, there is a gradual erosion of the tissue and relief from the tundicates. This is what a modern point of view, and this is the Ayurvedic point. And this is a very new procedure, and there is no need of hospitalization. I have not admitted cases so far. Just on OPD basis, I have treated all the cases. You ask the patient previous day, you prepare patient, ask the patient to come in the morning, and then morning you carry out the procedure, 10-15 minutes you do the procedure, and then ask the patient to wait for half an hour in your hospital, and when they are relieved from the pain, then you can send them home. And there is no need of general anesthesia as far as my knowledge is concerned, and there is no bleeding. There is a bloodless surgery and less pain comparing to the surgery, very cost effective. For anesthesia itself, anesthetic drugs itself, you have to pay a lot, leave about hospital stay, surgeon charges and post-operative medicine charges. It is very, very cost effective and better acceptability. Patient, once they undergo this, they bring some other patients. Better acceptability is there and encouraging results. Results are also very good. So it is having encouraging results. So now this patient from abroad also, they took treatment and they are also very happy. And when I started this procedure, I was alone. Nobody supported me. The first and foremost person to support me was my teacher, the late Dr. C.M. Saragman. I did this procedure when I was in final BMS, and I told to my teacher, and then in his OPD, any tonsillitis patient comes, he used to give me, and I used to do the procedure. By the end of my internship, I did 14 cases. Okay, 14 cases. And he is the first person to join. And after that, I gave lecture at many places, and it is accepted and appreciated. And now, you all people who have joined today's meeting and attending this lecture. So, I would like to say that Chalata Akela, Chalte Chalte, Kafila hi bas. Thank you very much for attending. So now I would like to share some of the video clippings. Apart from tonsillitis, see this one I give you, I will show you a video clipping of tonsillitis, how this procedure is being done. And after that, I will show you the other diseases where it is being successfully adopted. Okay. No, just is being applied. My teacher is doing this procedure. So you can use buttermilk, you can use kanji if lemon juice is not, but I prefer lemon juice. Patient is very cooperative. One thing. So buttermilk is given for gargling. Buttermilk, because if something is left or patient if he has consumed little chara, it will be neutralized. Gargle and let the patient drink it. Patient is very happy. And later there will be a wound, and there is after second day, and then gradually it heals and looks like this, and the size is reduced. You can see fourth day the size is completely reduced. Thank you. And if you have doubts, you can ask me questions, and then other video clippings I shall show. And I think I got some questions, and let me see. Kiran, Dr. Kiran Mantri, to everyone, very nice seminar. So I want some questions, then the words of appreciation. Thank you for appreciation. But along with that, if you have some doubts, then you can please ask me. Video.
Any questions? Anyone else? Participants? Unmute yourself or raise the question in chat box. Participants unmute करना चाहिए chat box में टाकते हैं. और Solanki sir. Sir. Sir, yours.
Yeah.
Yes, sir.
Yeah. What is it?
Sir, if you give your expert opinion.
Pylorodial sinus.
Yes,
But there is Kshara Karma in pylorodial sinus.
He wants
if you
to show
want
one
that,
more. Let's go ahead.
yes, just photographs I want to show.
Yes, sir. Yes.
Okay.
Just photographs I want to show. Nice. You stop the bleeding first and then apply Kshar Karma, do Kshar Karma. Okay. Kshar Karma, the site of Kshar Karma, see the skin, epidermis, up to the epidermis is sufficient, no need to go deep. There is the site of these hairs or hair follicles. By application of Kshara, their hair follicles are destroyed, and that area hairs will not grow. That is one. Because whenever it is a pylorodial sinus, there are theories. One is local hairs, and another is the other parts of the body hair. It's not necessary that person must be hairy. Even female also get this disease. And natal cleft should be made flat. The purpose of making this procedure is to make the natal cleft flat. So that is achieved by this Kshar Karma along with destroying the local hair follicles.
Samudri sir. Sir, we have seen the same case in our OPD here, and we did we did Kshar Sutra in that this PNS, and after that repeated treatment, but we could not see hairs that guchas of hair in that sinus area. So how this?
Yes, yes, it's a very good question being asked. Sometimes the sinus is filled with the hairs, and sometimes when there is acute infection and there is pus is removed, or sometimes pus drains out by itself. So that time hairs will not be there. It is not necessary that hair should be compulsory present. But if the sinus is there, it is discharging often and often, and there is what I say, the continuous presence of oozing of this sinus, and the sinus is not closed, then you need to do this procedure.
Sir, have you seen recurrence in this type of means Kshar Sutra application in Kshar application in pilonidal sinus or this tonsillitis?
Yes, even after doing, see, every procedure, whatever procedure you do, all the procedures, they have some limitation. 4 to 5% there is a recurrence, or even though there is no recurrence, the symptoms will be seen same or similar symptoms exist. For example, even after cholecystectomy, the features of the cholecystitis exist.
Yes.
Okay. Even after appendicectomy, the features of the appendicitis, they exist. So like this. Another one, the cryptograndular origin of this fistula, I would like to show you here. Bombay PPT This is after Kshar Karma, it is. Yes. Bombay. Yes, madam, any other question you can ask me? Solanki sir is here, expert.
Solanki sir. Solanki sir.
अनम्यूट करिए सोलंकी सर को.
Unmute कीजिए सर. Oh.
Yeah, I was muted by the computer. Anyway, I'm audible, I believe. Yeah. It was a very good and innovative presentation. Let me frankly admit, it is new for me also. The Kshar, Pratisarniya Kshar in Tundikeri or tonsillitis abbreviation. Dr. Samudri and I go in long way, and we have been associated in various conferences and workshops also. A great proponent of Ayurveda surgery and the parasurgical procedures also. He had wonderfully shown in our surgical workshop, national surgical workshops, about the various incisions Sushruta has described, Langlak, Arthur Langlak, etc. He had shown actually the incisions on operative workshops. And parasurgical work, this Pratisarniya Kshar, excellent presentation. I really appreciate. I think the budding Ayurveda practitioners will take a great clue and margadarshan and guideline from Dr. Samudri's presentation. They are carrying out a very good and impressive parasurgical work in their institution and in their practice also. See the amount of success and this clinical application itself, the patient showing on where you are avoiding the use of antibiotics and the hazard of using the non-steroidal anti-inflammatory drugs in such conditions, which are very common in young and children as such. Very good presentation, Dr. Samudri. Thank you for showing this new method. I'm sure it will be quite useful for us in further extending our parasurgical procedures. Thank you very much.
Thank you, Dr. Samudri, sir.
Sir, are you showing some clip, Samudri, sir?
This is
You have shared screen.
this is another video where Kshar Karma is done in arshas.
Okay, sir.
In rights.
Sir, please.
You can see. And you have to wait for Shatamatra Kala. That is 30 to 40 seconds, sufficient. Wait for it and then you can remove it and then apply lemon juice. You can appreciate the color change. See the color change? Pakwa Jambu Phala.
Yes, sir. Yes, sir.
The class is 20. Class is only first. Yes, this is lemon juice. So this is and other two you can, and there is one hypertrophic papillae you can see that's being marked there. Yes. This rectal prolapse also, partial rectal prolapse also you can do Kshar Karma, and you do Kshar Karma in Bhagandara, incision and Kshar Karma, and in some of the skin diseases. Ringworm infestation is there, hypopigmented patches are there, and some other this Kitiba, Kushta is there. There also Kshar Karma is successfully practiced.
Thank you, sir.
Thank you, sir.
For
Yes, madam.
Yes,
Yes, sir, please.
Please, sir.
Samudri, sir.
Yes, yes.
You are saying something.
No, sir.
No, just this is what that these are other diseases also I have mentioned where I do practice Kshar Karma, and I wholeheartedly thank all the organizers for giving me opportunity to share my views. I am thankful to Solanki sir for giving his expert opinion, and Department of Shalya Tantra, and all the people who are directly and indirectly associated with this webinar. Thank you very much, and thank you once again.
Thank you very
sir.
much, sir.
Thank you, sir.
Thank you for sharing your expert clinical knowledge to us. It gives new dimensions to our thinking process in our clinical practice. Our today's all sessions are full of clinical feast for Ayurvedic practitioners. Thank you, Dr. Kadri sir, Dr. Vashne sir, Dr. Solanki sir, and Dr. Samudri sir for giving your precious time and sharing your knowledge with us. Now, I declare that our today's session is over here, and tomorrow we will meet at sharp 10 a.m. for second day of our national webinar, that is Parasurgical Procedures New Horizon. Thank you all of you.
Sir,
Thank
sir,
you.
I request to all of you to join tomorrow because we are going to announce the winners of paper also. We are going to publish an abstract book with ISSN certified journal. So we are going to announce their name. So please also join tomorrow. We will expect your expert opinions also.
Thank you.
Thank you. Thank you.
Thank you. Thank you, everyone. Thank you, Vasu sir.
Thank you.
Thank you, Dr. Vinay, Dr. Shilpa.